sorry, touch that seat.
Hello? Are the microphones working? Excellent. So if I can have everyone in the room quiet down. It's just after 6 o'clock. The Board of Health, the Board of Selectmen, and the school board have all assembled. It's actually very unusual for all three of these boards to get together in the same room. So I'd like to thank everyone who could make it here. I just want to, at the very outset, clarify that this is a public meeting. It's an opportunity for our boards to actually get together to discuss business. It's not necessarily meant to have public comments to us, although if we decide to entertain that, we could. But it's mostly for the boards to actually conduct their proper business. And so with that, I am part of the Board of Health, and I just want to do a quick introduction of myself and the other members of the board. So my name is Nathan Walsh. I'm the chairman of the board. I have a PhD in biology from MIT. I've been a co-author on a paper about evolution of proteins and viruses. I've worked at Harvard Medical School, Brigham and Women's Hospital. For the past 2 years, I've been working at a company that makes instruments to detect pathogens. And so I'd like to introduce the other members of the board, Dr. Alan Ehrlich.
Hi, I'm Dr. Alan Ehrlich. I'm a family physician. I've been with Reliant Medical Group for 27 years, and I'm an associate professor of family medicine at the University of Massachusetts. And I've been on the Board of Health here in Westborough for about 18 years.
And Dr. Syed Hashmi.
I'm Syed Hashmi. I'm a diplomat of the American Board of Surgery and with a subspecialty in critical care. I'm also a fellow of the American College of Surgeons. As it turns out, I'm also a member of the Board of Selectmen. I thought I should mention that.
So with that, I'd like to, could I have someone advance slides for me? Is that possible? One more, please. So the Board of Health, we have some guiding principles that we operate by, and unfortunately, I wish there was a screen in front of me so I don't have to keep turning around to read it, but I'm going to do so anyway. So all of our decisions, we try to make them based on facts. Rumors do get spread. A lot of people base reactions on what neighboring towns are doing. But this board here, what we really try to do is actually look at the facts that are available and make decisions based on the facts that we have. The actions, actually, if you could stay on that same slide. Everything we do is done to protect the public health. That's why we're here. It's what we do. And we want to make sure that everything we do is actually consistent with public health and also consistent with the law. And finally, we really do want to minimize any disruptions to individual rights and the liberties that people in this town have. The state has, through the Constitution and through the different provisions of the law, have given the local boards of health a tremendous amount of power, and we try to exercise that power, understanding that our job is to protect the public health and to minimize kind of the impact on individual people's rights and liberties. So if we can go to the next slide. There's a few things up here. It's basically just to kind of give an overhead as to some of the major organizations and where they stand on this coronavirus outbreak that we have, the COVID-19. The WHO has gone from being a public health emergency of international concern to actually declaring a pandemic. The US government has instituted various travel restrictions. And the Massachusetts Department of Public Health has actually recently gone from saying that Massachusetts overall is at a low risk to being a rising risk. And so with that kind of as background, there's a few things that we have both the school board here and the Board of Selectmen. I think if, Amber, if you're okay, I was going to have, if you have anything to announce, that you can come to the front and
view from out here. Hello. Amber Bach, 10 Arch Street, Superintendent of Schools. Thank you for convening the boards tonight. And
Daniel Mayer, I'm the Assistant Superintendent of Schools.
so we thought that it would be productive to provide a brief update to you on currently, we get a constant feed on what's going on with the districts across the state, and then also what we're currently seeing, and then I think where we stand on recommendations for moving forward. Is that what you would think would be helpful?
I think that would, yes.
All right, so Daniel and I together will kind of give you a picture of what's going on across the 350 districts. We tend to look at what's pooling most directly around us for within the 128 belt, and then around the 495 kind of unit of districts that we interact with. A couple interesting points to make. The MIAA today, in charge of all athletics, closed tournament play for the end of all winter games. All the state level tournaments are canceled, and they've displaced the start of spring sports till the end of March for a second reassessment. So they released that today. Currently in Westborough for ourselves, we canceled the SATs, which we had talked about currently maybe holding. We've canceled those for this Saturday, and earlier today, kind of late afternoon, moved in the direction, after the MIAA canceled the state level playoff games, we felt that the benchmark of having maintained the play really then had to move to a different level of consideration, which was that we would postpone the spring play, which would have occurred tomorrow and Saturday.
So is that canceled, Ms. Balk?
So as of now, postponed until some later date where we to ever have a chance to perform that. But the decision being that we had high value things where there had been lots of efforts put forth to complete them, we were moving in the track to try to modify that, reduce the number of shows, and let them have some type of closure on that, since it was literally 2 days before they were supposed to be able to finish. But given the MIA's cancellation of a very similar high-level type of completion of an activity with the state sports, we kind of are working to be very parallel in our decision-making. So we canceled the play today. So those are the current updates for where we are in terms of practice. And before we talk about our current recommendation, I thought it'd be helpful for Daniel to give you a brief update on just what's taking place across districts around us.
Yeah, sure. I think, and also for context, I would say that, prior to today, one of the things we were doing internally is assessing all large gatherings that the school was assembling, both internal assemblies and also like fundraising events. And we have a spreadsheet that has close to 120 events where we're assessing where anybody, what the crowd size was going to be and whether we were postponing or canceling. And so we're looking at that. But things are moving, as you know, very rapidly. And there's a number of schools that are announcing decisions today, 24 hours before the governor is going to come out tomorrow morning with recommendations as to what the schools should be doing. So we're, looking very closely at what the governor's recommendation is going to be tomorrow. But right now, the state of play is anything between 4 categories is not being closed at all, to several districts closing one school to do deep, cleaning here and there, like, Framingham or Brookline, and there's several districts that are like that, to within the last few hours, there's a group of districts that decided to close for at least 2 weeks. That includes Arlington, Bedford, Belmont, Burlington, Lexington, Wellesley, Woburn, and Winchester. Those are districts that are closing for 2 weeks. Newton and Natick have announced that they're closing for 1 week with the possibility of closing for longer. They were going to be on live TV? Yeah, they're not live TV. I can't find it.
Sorry about that.
No, it's okay.
You can continue.
Is Lee conferencing in?
Can you just put it on mute? On your side, thanks.
So Newton and Natick are basically have announced that they're closing for 1 week, and that they will make a decision at a later time in terms of at the end of next week as to whether we're going to extend that. So I will give it back over to
So-
Amber in terms of what we're thinking.
So first, I would say that we've been, of course, speaking with Steve Bakari daily and working on each of this. And our perspective has been, with no identified cases in Westborough in this area, that we have been taking the perspective of keeping routines as normal and monitoring and taking guidance from your board around how to take steps forward. We've been waiting for direction, I think, to see consistency from the state about how to best respond. And we're really hopeful to hear tomorrow the consistency of guidelines coming out from the governor's office with regard to schools. That conference call is in the morning. Regardless, I think what we know as leaders is that when organizations start to splinter and do a variety of different practices, it causes a spike in anxiety, an increase in a sense of lack of trust with people's feelings about how we're making decisions. I believe we've been making smart, thoughtful decisions step by step. I think the recommendations from your board to maintain our practices have been sound thus far. Given the way this is coalescing, I think our perspective at this point is that we would take a step back and that it would be most logical not to continue to spiral people's anxiety where it's simply going to become a contest to try to compare what all the districts are doing. That's not sound practice for us. It's not how we do things here in a district and at the town level. So we're anticipating at this point that we would close next week, would be the preliminary recommendation that Daniel and I brought to the board late afternoon, and I discussed with Steve and conferred that he felt that that would be a sound window to give us an opportunity to step back and wait until we can get consistent and clear guidance from the governor's office and Department of Education and the Mass Board of Health in collaboration with your board as well. I think my board in general is in favor of that. Again, we haven't had, it's a good thing it's a joint meeting tonight. We haven't had, a time to have a discussion on it in depth. But, I think that we would anticipate that we would, at this point, we would hold school tomorrow to have an opportunity. One, we have a lot to think about. We haven't had chances to update our staff, to put plans in place, to give people time to plan. So I'm anticipating that our recommendation as of this minute, sitting here before you for discussion and consideration by the boards, is that we would hold school through tomorrow, leaving families their discretion if they're so anxious they want to keep their child at home. That, of course, is always a parental right. We would anticipate conducting school tomorrow with the acceptance of your board as that being logical, and we would implement a one-week closure starting Monday through Friday next week. Hear the confirmations and guidance from the governor's office tomorrow and confer with the boards. Then further, I would imagine we would reconvene and then take guidance on how to take best steps forward. We have decisions to make in terms of how we manage that time. How are we paying people? What are we doing in terms of hourly rate employees? You can imagine when we close an organization of 700 employees, we need to kind of be thoughtful. We also have 4,018 students that we're responsible for that will be beyond our care within that 24 hours, and we don't take that lightly, as and I know you don't either, which is why your recommendations have been for us to try to maintain the consistency of practice. To have 4,018 3-year-olds to 22-year-olds now broken from daily programming is a very serious change. And we feed lunches and breakfast to a large number of students who have food insecurities. There's a whole array of, we have students with fragile learning profiles and health needs where we administer medications. We have extended day programs. We need to know, are we closing those as well? So we have a slew of decisions to make, and so I think giving ourselves the weekend to put those in place would be important next steps.
You guys make any comments on that?
So, Ms. Bach, again, I know this is an evolving situation. I appreciate your and your department's work on this, Mike. One of the big things that you have that certainly the Board of Health does not have is that you have the ability to communicate to a large group. And one of the concerns that I've had, certainly amongst, I'm just speaking because I've not had a chance to talk to the board about this, is getting the message across about of good public health measures, such as social distancing, and not just in not just in English, but in other languages. My concern is that there may be groups in town that attend your school that may not have a good comprehension of English, may not understand, and they are socially isolated. So you have the ability to reach that population far more effectively than the board can. So I don't know how we can work to improve that communication, to get that word out. I know the DPH has, Steve, correct me if I'm wrong, so the DPH has some things in other languages. Am I getting that right?
Sorry. I'll just get up. So yes, on our website, there's a link to the DPH site. There are fact sheets on there in, I think, 8 or 9 different languages about coronavirus, that sort of thing. It's somewhat limited. It's a 2-page fact sheet, give or take, but it does talk about, preventive measures, what to look for, those types of things.
All right. And the other, Mr. Chair, can I continue?
Please.
The other thing that obviously, and I know this is may not be your bailiwick, but I am, like you, deeply concerned about the food insecurity of the children in your school. And I'm wondering, I recognize a lot of those children get warm meal. I mean, yours may be the only meal that some of these children get. So I recognize it's short notice. I'm wondering, are there mechanisms that, I don't know what the town or the community can do to provide those meals, or is there ways we can help? What can, because I'm worried about that.
No, that's just part of the intricacy of the decision-making that has to happen quickly, and that's part of what we do. So I certainly have confidence in our team. We're not going to abdicate our responsibilities to the care of our children. I think what it means is that we have to be able to move quickly and nimbly to figure out how to do that. And I think it's important, and I appreciate the opportunity for us to come together and to have a public forum on it, such that people realize it's not that the school board or the administrative team can't or wouldn't have, nimbly decided to close earlier in the week, but that the implications and the impacts of that are extensive as well, and a range of, outcomes around the types of things I've just mentioned. So I think being thoughtful about it and taking the steps we have was important. We've had some preliminary planning. We've at least named out loud the things that we have to be able to put in place, and that will be what we will start working on. So we'll be looking at food delivery and the types of things that we need to put in place. So that has to happen as long as, as quickly as possible.
And are those, the children that are, especially the disabled children that are under your care, are those the only, is there any outreach for them, or are they just taken care of in your facilities?
Well, I think that students who are medically fragile in our building still return home at the end of the day. I think it's important to realize, though, that for 6 hours a day, we supply respite to those parents who are typically then giving 24-hour care to complex students. And we share a really important relationship together in co-care of not just educating, but care of their children. Of course, they have complete competence to care for their own children, but I think in terms of the responsibility and the burden, schools play an important role to provide consult and opportunities for those breaks. And if you look at an extended amount of homeschooling or home care, there's, as you well know, as a board of public health, and all the emotional toll and stresses that play into that as well. So all of those are things that we have to bring our leadership team together and think about. We'll start with, kind of a radius of planning, and that's certainly a practice and protocol that we're comfortable with.
Well, thank you. It's actually very nice to have such a competent group of people working in our school that have thought through a lot of these things. And I think that as we go to make recommendations or to support your own recommendations, some of the ideas that we worry about are the same exact things that you worry about, and that is, even if we had a closure of schools, asking ourselves the question of what does that really mean? Does that mean that all services are stopped, that that you still have some essential services going on? As you mentioned, extended day, how does that happen? It's a little more complex than just is everything closed or is everything open? And we're aware of that as well, and we're glad that you're aware of it and thinking of that, and that's something that we're going to have to spend a little bit of time tonight talking about. But it is nice, I think, for those people that were tuning in and listening to figure out what's going on. For the most amount of students, it sounds like your recommendation is going to be that there is no school after tomorrow, and that we're going to be working through some of these details in that
Yeah,
time
it does the extended day program, which provides extended day to a lot of youth, will close along with us. So, again, people are going to have to find alternative daycare.
Yeah, which is why making it so that it happens instead of, immediately tomorrow morning, that
Right.
giving a little bit of leeway helps people kind of adjust in this difficult situation. Do you have something you want to comment? Or should I go on to one more slide? It just has some more facts on there. You want to jump in?
Yeah,
Go.
just a
Yep.
couple things. So first of all, I appreciate you pointing out the fact that right now we've not had any cases here in Westborough, which is important. I know that the Board of Health has been working with you closely to monitor the situation on a daily basis, and if there were any need to have taken any action beforehand, it would have been done so. What you're proposing, in my opinion, is not essential. It is a degree of caution. It's prevention. And as such, we don't know what's going to happen next week. This gives us some time to sort of see how the epidemic evolves. The two concerns I have, one involves thinking about, okay, how do we assess the status of things next week? And my advice in that regard is to not wait till Friday, where we have to make decisions sort of all of a sudden. Either Wednesday or Thursday would probably be a good touch point for considering what are the options. And then I think it likely, even if it's deemed okay to open up in a week, you will have students who are at risk based on their health status that may need to remain out of school on a more prolonged basis. And I think that developing a plan for, first of all, how we message to parents who we consider to be at risk is important, and then having a clear plan of how those students' education is going to be managed would be important.
Can I just add something else?
Yep.
So to the general public, it's important to realize epidemics come with, especially those that are very infectious, like the COVID-19 disease, they come with a spike of cases. And as more people get infected, and the COVID-19 disease is very infectious, there's a rise in cases that keeps going up. What you aim to do ultimately to control an epidemic is what epidemiologists call flattening the curve. So if instead of a curve of a rapid rise of cases that goes up like this and the infection spreads, what you want is a slow rise with less transmission. And ultimately that is what we aim to do, is to slow the risk of transmission till the epidemic runs its course. Sorry, Dr. Walsh.
Yep. No, I think that's fine. Can I actually go ahead one slide? I think there's just some facts and figures on there. Yes, thank you. So this data is actually from yesterday. I think they've actually just updated it. The numbers aren't substantially different, but as of yesterday, there were 95 cases of COVID-19 in Massachusetts. I think today it's 108. But there's about 1,000 people that have been subjected to quarantine, and about half of them are still under quarantine. The others have spent their 2 weeks in quarantine and have been released, and I think actually a few of them have actually died. So testing is being done by the State Public Health Lab, the CDC, and very recently commercial and clinical labs in Massachusetts have been starting to do some of the testing. The testing at this point is, I think, less than I would like, and some people that may be involved in this may have that same sense. In this graph in the bottom corner, there is, in blue, is the testing that has been done by the CDC lab, and in orange is the testing that has been done by the state public health labs. And what you can see is a pretty low amount of testing by the CDC, and that's reflected when you hear numbers like there are 108 cases in Massachusetts, and 6 of them have been confirmed, and 102 are presumptive. What that means is the 102 have been tested in the state lab, and the people have COVID-19. The 6 have been tested in the state lab and by the CDC lab. And so that's why they call them confirmed. But the CDC has basically encouraged the state labs to take over this job and do the testing. And the state lab has found that they also need help in getting the testing done. And so they're looking for commercial and clinical labs to also help take up this testing. So what you see is a dramatic increase in testing. We expect that as we increase the testing, as Dr. Hashmi had said, we do expect to find more cases. It allows us to actually do a better job of identifying who needs to be isolated or quarantined and help with this process. As has been mentioned, I think even as of today, there is only 1 case of COVID-19 in all of Worcester County and none in Westborough. So as Dr. Ehrlich had said, any actions that we take here tonight are due to an abundance of caution, not because we are here in Westborough in the midst of a full-blown panic. We're just, at this point in time, we're not. But what we want to do is reduce this level of risk. And so with that being said, people in town are worried. There are connections from people in Westborough to lots of other areas in Massachusetts and the United States. And you know, I think they were playing a game in school today where it was, how many degrees of separation do I have from somebody who has COVID-19? The kids are definitely thinking about this. They can actually track how close they are to different people. And, but I do want to just let everyone know that there are no positive tests for people in Westborough as of this point in time. So if we can actually go ahead one more slide. What I have here is kind of the way that I think myself and hopefully the Board of Health behind me kind of thinks about these cases. And that is that for every action that we want to consider if we didn't take the action and if we did take the action, and look at both the risks of doing that and the benefits of doing that. And as we go to make these decisions, it's important for us to actually kind of look at all 4 of these key things of, you know, the risk of taking no action, the risk of taking an action, the benefits of no action, and the benefits of not taking an action. And I want to, as much as I think people would love to have kind of general principles to just say that gatherings larger than X should be canceled, there's a lot more detail to it than that. And there are certain things that provide essential services to the town. At certain meetings, there might be serving of food, or there might be eating of food, or how crowded the people are in a particular room, access to hand washing stations. All of these little nuances do affect kind of the safety of any meeting that we have. And so it's important that, you know, as we discuss what we do want and what we don't want, we're going to try to set as general parameters as we can, but that might not be possible in all cases, and we might have to kind of look at the very specifics of some things that we want to do. And so, let's see, did the Selectmen, I just want to give them a chance if there's anything that they would like to do before we kind of get more in depth into some of the stuff we're going to discuss. Is this a good time, or did you want?
Yeah, I mean, I think this is probably a little awkward because this is board meetings, and so I do have some things I think we want to discuss as a board because we haven't met as a board to discuss these. So whenever you want to go into that, I do have some comments and recommendations that I'd like to present to the Board of Selectmen as potential recommendations to the Board of Health as you consider actions you may take.
You comfortable with this being the right time to do that?
Yeah.
Okay, go ahead.
So again, thank you everyone for coming. And to the board, I think there are, in looking at what's been done so far and in terms of what we've heard from federal government, what we've heard from the governor, what we're seeing unfold. It is unfolding, it feels like second by second with changes. So I think while we don't have cases in Westborough, I think being proactive versus reactive is a benefit we have, and I think we should take advantage of that. So I have some recommendations I would like to throw out for discussion. So one would be recommending that we cancel all non-essential meetings, activities, and events from the town side. Sounds very similar to what the school has already talked about here, but doing a similar thing and really looking at those non-essential. And Nathan, you just talked about what's hard, essential services, whatever, but things that are non-essential, meetings that are non-essential, activities that are deemed non-essential. For example, I know that the senior center had a planned St. Patrick's Day luncheon that they have already gone ahead and canceled, but things like that, while they're great events, if they're non-essential, I think it's for the protection of individuals in the community, that would be a smart action to take. Listening to the schools here, and I apologize, these may be more controversial and would love to discuss them, but I recommend, again, around activities, that we consider a closure of the library, a closure of the senior center, and a closing of our recreation department events as well. I would also recommend we consider kind of our town hall operations, and are there, can we do work there in terms of reducing town hall employee presence, reducing potential services, and how we may go about that. I've asked the town manager to schedule a meeting on Tuesday, this coming Tuesday, for the Board of Selectmen as well, but have asked for her and the department heads to consider what that may look like as well, in terms of essential services that we may need to do and what we may be able to do to, again, protect our employees as well as our residents, but also still ensure that we provide services there. Two other things, as folks know, we do have a upcoming town election this coming Tuesday, followed by 2 weeks from Saturday, a upcoming town meeting. I would like to, I think we should consider in these things, but town elections are run under the town clerk, and I would love to get comments from her or whatever, but the potential of the consideration of postponing our town election, and maybe we can have a discussion on that, as well as, and I know the town moderator's in the back here, of, again, potentially a recommendation to consider a postponement of a town meeting, again, based on the rapidly evolving public health concerns that we see. So I know that's a lot there to the board. So I'm going to turn to you as a Board of Selectmen member, not a Board of Health member.
Yes, okay,
Switch hats.
Yes, so just to be clear, I'm speaking for myself today. So, Mr. Chairman, have you thought about limiting the size? One of the things that the Board of Health had kind of mulling over at our meeting on Tuesday was limiting the size of public gatherings. Have you, public meetings, have you come to a consensus about that?
I would be interested in discussion on that. I don't have a number. I've seen different things out there over time. I've seen, numbers, I think, as high as 100. I've seen as low as 25.
Yeah, I think that's
from the
something
governor's side, but I think that's something to consider. Again, I guess my thing is, I think there are meetings that have been scheduled that perhaps public hearings that have been posted and whatever, similar to town meeting that has been posted, legally posted to occur on Saturday, March 28th at 1, ways to look at that. But I do think that if meetings are non-essential, I think we should potentially see if they can be postponed or moved as well, even if it may be a small number. If it's not essential, do we really need to put people in those situations if it's something that can be postponed or changed?
Thank you. So I basically had 3 more slides that I was considering showing. The order of them might not be appropriate in the best way to discuss them, but basically if we can just flip through those 3 real quick. They regard basically having us consider things related to travel, and then actions related to events, and then finally actions related to buildings. And we probably won't cover them in this order, but kind of what my thought process before this meeting and before talking to anyone here was basically laying out kind kind of where do we want to be, and I think as Dr. Ehrlich had said, kind of laying out what do we use as criteria for making the decision about where we should move our line, and how do we decide when it's safe to reopen things. And so hopefully tonight we can get to the bottom of that, and I'm kind of a little bit open as to the order that we tackle these. I think that some of the things regarding the schools might be of largest interest to the largest number of people, and so maybe that's the best place to start, but I'm open if you guys want to suggest a different order.
I'm fine with starting with the schools. I wanted to make a general comment.
Please do.
And this is in light of some of the suggestions that had been made. I think the idea of limiting large gatherings is a good idea. The idea, however, is not that people should all go to their homes and never leave until they get the all-clear signal from the governor. There's got to be something in between, because what Syed had said that's so important is this notion of flattening the curve. It is not that we will not get exposed to coronavirus. In theory, most of us will get exposed to it, and we will have a small cold and get better. People who are vulnerable might get very sick from it. So we first of all want to protect vulnerable people, and the best way to do that, of course, is ultimately herd immunity. And herd immunity happens when otherwise healthy people can no longer transmit that disease. So if we all go into our homes and nobody leaves for 2 weeks, then when we come out, we're right where we were before. So we have to be careful about what measures we take. I think what the school department has advocated makes sense because things are changing so rapidly, and it's give us some time to see how this is evolving, especially where you have a situation such as schools where lots of people are coming together. So, for instance, things like the library, I'm not as keen about saying we should close the library. To me, the main reason to close the library is not for the people who would come to the library, it's for the protection of the town employees who work there. And that part I get. But again, I don't want people to leave this meeting thinking that going outside your home and interacting with anyone else is putting you at some type of incredible risk. We have to find some middle ground.
And can I just,
Please.
Just bounce off what Dr. Ehrlich had said? Social isolation comes with its own costs, and and especially in the elderly, it leads to increased morbidity, increased risk of illness and of death. And the other thing that is going to be critically important as we go through this is truly that, and I have great hopes and I have great faith in our town, is that we really need to open our hearts and not let fear and racism and anger rule our emotions. This is not the time or place for it. This is truly a chance to show our better selves, for want of a better word. Thank you.
Yeah, I think that was well said. I think that we all should remind ourselves that this is not affecting any one group of people. There's no one group of people out there today that is more likely to be infected than any other group. And so as we, work with our town and other towns to kind of, come up with a coherent strategy, I think it does make sense to not be complete outliers of everyone else. I think that, as Amber Bach had said, that does create some anxiety when we're doing something very different than other people. And so I do recognize that, and would like to kind of maintain a little bit of that. The other thing I wanted to say is that this also happens to be a time where a lot of colleges are closing. And so what ends up happening when a college is closing or going to online only learning, a lot of students are returning home here to Westborough. And they're going to be bringing with them whatever they may or may not have been exposed to. Typically, around Christmas time, when all the students return, everyone gets sick from whatever regular virus that they get. Having all of these students return home is actually more likely to increase the chance that we have COVID-19 coming from multiple directions in town. And as Alan had said, or Dr. Ehrlich had said, this is not a panic. We don't need to completely shut our doors and bar anyone from communicating with each other. But we just do need to be aware, and I think that if the more actions we take, like washing our hands and, having good hygiene, is all going to actually kind of slow down the virus and spreading. And so I think that our policies that we put in place today should reflect that goal. Oh, please, yes.
I just wanted to speak to the closing of the library. We had a department head meeting this week to discuss some of the things that we were concerned about and how we might operate given all sorts of different situations. And with respect to the school closing, the library becomes a destination for many people. And so as you're thinking about what is an appropriate number of people gathering in one place, remember that the library is unable to limit the number of people if they are open. And so I think that that's an important thing to remember.
Are there no fire regulations about the number of people that may be in there? They have to accept as many people as want to come in?
They couldn't close their doors. I mean, I could let the chief speak to the fire regulations, but if you're talking about limiting to a group of 25, I would encourage you to talk to the library director who's here, but I would estimate that they would have more than that.
But I guess to that point also with the library, seating is scattered throughout the library. So there's social distancing in the different seating areas. You can have potentially the library open but not use the meeting room for meetings and not have special events. Or even provide a limited set of services might be a consideration. So, but yes, you're right, you can't, if people walk in the front door, you can't kick them out or have a club line outside for,
Can we,
with the
sorry,
bouncer.
just to add to that, is there, I know, I think Alma is here. Alma has a sign at your front door, am I right, Alma, of saying that if you're ill, is that possible to
Just
put?
to interrupt, this is at the senior center that you're talking
Right,
about.
so at the senior center, there is a sign that says if you're unwell, do not, what does it say, don't come in or something? But put more politely.
Yeah, if you've been coughing, have a cold, or fever within the last week, please don't come in. Due to how contagious this virus is, when you're well, we'll be happy to welcome you back.
Okay, so that's also an option, sorry.
Do you have it? Should we seem to be talking a lot about the library. Maybe we can knock that one off first before
Okay.
we then go back to the schools. Do you have any other comments about the library?
One of my comments is that I do think the library provides valuable services, particularly when school is not in session, not just for the people who come there, but for people who come and take resources to their homes, whether it be videos or whatever. So I too think that the idea of the spacing of the seating mitigates some of the risks there. You might have 25 people in the library, but they're not 25 people all in one room. And so there is some risk, and I think, it may be the kind of thing that the library can stay open initially, and if it appears to be a problem with overcrowding, then perhaps action can be taken on that basis. But again, for me, it's sending a bad signal if we feel that the library is too dangerous a place for people to come and sit and read and do other things that, services they provide.
Yeah, I think that they provide some very valuable services.
And which
in
will be
terms of
needed
checking
now
out
more than ever, especially if the school is closed next week.
But I think that's the concern. I think that's what the town manager did. I'd be interested to know, and I think Maureen's here on the library side, is when school is out, what is the number of students that are there, whatever. I am concerned that, as we talked about, that you don't want to just pass it from one to another, and I understand that, and these are not easy things for us to talk about. This is about, and Dr. Ehrlich, you hit it, it's protecting those employees, but also protecting the residents, and we don't want to just pass one to the other, and I do have concerns that, the schools close, the next place to go, we have a wonderful children's room and all that we'll have numerous large crowds.
Yeah, I think I just want to make one comment, and then I think the fire chief has something he wants to say. But in terms of, let's say, overcrowding at the library, it's going to be a self-selective group. The people that choose to go to the library are actually choosing to go there. It's a little bit different than something like a school system where the kids are actually required to go. They have to go to school according to the state law in terms of the number of days. Now, if they don't feel well, they don't go. But in terms of, it's very different about choosing to go to the library. There will be a lot of people, I would assume, that choose not to go to the library. And so that there is that fundamental difference there.
Do we know if any of the towns that have already, prior to this meeting today, closed their schools for 1 or 2 weeks, have also closed the library?
I did, excuse me, sorry. Sarah DeLay, school committee chair. I did notice today when I was looking at schools, Wellesley closed their schools for 2 weeks and closed activities at the library, but did leave the library open for now.
Okay. Mr. Purcell, you have something to say?
So not only am I the fire chief, I also serve as the town's emergency management director. I just think before we go forward and start, I think it's my opinion, before we can start to decide what should be open and closed, we're talking about crowd size. I think we should establish what that number is going to be first. That might help us to decide which buildings stay open and stay closed. Because though I don't know the occupancy load of every building in town, I can tell you municipal release is at the door. I can tell you volume probably greater than 200 in that building, correct? So there's a potential for up to and greater than 200 people. But I think that designating that number first, what are we trying to restrict the crowd size to, is probably the horse in front of the cart.
Yeah, I think that if there were 200 people in our library, that would be a very crowded library. Yeah. We've got one question behind you. I don't know if you can maybe come up to a microphone.
Hi, just a small concern, or maybe a big concern, I'm not sure. But the library, we're talking about, people handling books. It's easy to wash your hands. How are you going to wash the books? That's going to become a source of spreading the infection. Is that something we should consider?
Yeah, do we have someone from the library here that might want to make some comments just about the general library? Director. Yeah, please, if you can come forward and find a mic, I think it would be very useful to hear your input.
Sorry to put you on the spot, Maureen.
And I apologize for not knowing your name.
I think it's on. Oh, it is on. Maureen Amiot, 6 Arch Street Library Director. And what Christy mentioned earlier about the library being a gathering place, we are a very busy place when school is not in session. During school vacation weeks, summers, and weekends. The weekends are the busiest days of the week for us at the library. It's when all of us are not at work and we're there with our families and our kids, checking out books, coming to events and activities. So if that answers your question, the person who just asked about the books, that's a debate that is going on our email list across the state of whether we need to sanitize and disinfect library books when they're returned. That's a question a lot of us are referring to our Board of Health, but we don't really have clear guidance from statewide. Some libraries are, some are not. It's a staffing and capacity issue. Some libraries are just wiping down everything with Lysol wipes, but as we all know, Lysol wipes are a hot commodity these days. Other libraries are not because they don't have the staff capacity to be able to do that. The volume of materials that come in and out of our library, it would be a very daunting task to do that, but if the Board of Health decided that we needed to do that, then we would find a way and we would do it. So does that answer your questions? Is there anything?
While you're up there, I do have one question.
Sure.
I don't know if you were around last weekend at the library, but do you have a sense as to, now that people are obviously worried about COVID-19, did you see a drop-off in use of the library, let's say over the weekend, or was there an increase of people going to the library, or was it about the same?
The weekend was kind of normal, but since Monday, we've seen a huge decrease in the number of people coming in.
Okay, thank you.
But correct me if I'm wrong, the mechanism of transmission of the disease is mainly respiratory. It's the transmission through, touching surfaces is less likely. At least that's what I've read.
I think it's respiratory droplets.
Respiratory
Those
droplets, right, yeah.
Can actually get on surfaces. I think that's why we recommend washing hands and not touching your face.
Yeah, the droplets can persist with infectious particles for a period of time, but it's not a prolonged period of time. It's an interesting question about the books or videos or things like that. And after this meeting, I will do a little research, but I've never heard of cases documenting spread of illness through library materials. Now, it may be that it happens like with the flu and nobody has ever looked at it. It's not saying it's not possible, but it's certainly wouldn't be as high a risk as the other ways that you've mentioned.
And just from perspective, there are a lot of different types of viruses. The coronavirus is one family of virus, and it is not known for being super sturdy. There are some viruses out there that can last hundreds of years if they're on a surface and still be active and present. The coronavirus is not one of those. It tends to be broken up very easily. And so from that point of view, we don't have any really great data at this point in time as to this particular novel coronavirus, but it's most likely going to be similar to the other family members in the coronavirus family.
I have one more question, which is,
Sure.
have you heard from any of the staff at the library concerns about coming to work and interacting with the public?
I haven't heard concerns from the staff. We've heard a lot of concerns from the public when they come in, but I haven't heard anything from the staff about being concerned about coming to work. Yeah. They are more of the mind that they really want to be at work because we want to be there to help our community.
Thank you. So we may want to take action at this point now about deciding if we want to take any action about the library or not. Or
Can I ask, sorry, just to, two things. I do think that Chief Purcell had a good comment that we should discuss whether it's a library or whatever in terms of numbers.
Yeah.
Two, what I would, as you get to the library discussion, if a decision is not to close the library, perhaps a recommendation that all events and activities, as we heard that other towns may be doing, that would, at least at a minimum, be something there if you decide that, at least at this point, the library should stay open. So just something that I would request.
And to add to that, in addition to limiting or eliminating activities and other things other than circulation of materials, a campaign to encourage people to go online and check out the materials online, so then you're going into the library, you're picking up the materials, and you're leaving. And so it's more of a, I don't want to say it almost, it's more of a retail experience than it would be a go to the library and linger.
Yeah, I think that's a nice recommendation.
And that still gives the community access to, the breadth of materials and services that the library offers while still limiting exposure.
Yeah, so I don't know, maybe at this point, in terms of core library functions, if we want to make a recommendation that we, or maybe we don't even need a recommendation, but if we want to keep it open, certainly that's my leaning. I don't know if anyone else on the board has
So I think, to echo what Selectman Johnson said, that maybe we should start with the number of people in the building and go from there. I think that as the chief, and I think that's, I would like to limit the number.
Unless we're going to change the occupancy of the library, it's going to be hard, I think, to enforce that there be a certain number of people in the building at any one time.
Can we enforce, Christy, I'm looking to Christy and the chief, can we enforce a limit?
I think the town council is shaking her head no.
Yeah, it's a public building. So, certainly you could cancel the activities, as Selectman Johnson mentioned, and then that way you wouldn't necessarily have as many people potentially congregating in one area, but we can't close the doors to just 25 people or 50 people.
Right. So my question to the board and to the library is, we have a reasonable group of people, that can revolve and think, is it possible for us, okay, if we cannot limit the size of people in the building, can we just say we will leave the library open subject to what happens if, for instance, there are 200 people in the library and obviously that is posing a risk, then the board can close it, yes?
Yeah, so, sorry. So my recommendation would be that we have the library meeting room be closed and that no events be held, but routine the library be open for routine activities such as people coming and reading the newspaper or other periodicals or circulation activities.
With social distancing, right? With encouraging social distancing, right?
Well, again, when my experience, and again, I'm going to look to our expert, but when you have activities, they're popular and you get crowds, okay? And when you don't have activities, then people use the library as it's laid out, which has natural social distancing. So if you don't increase your seating arrangements and the meeting rooms are closed, I think the problem of overcrowding, too many people being there, are unlikely to be a problem, but obviously if it were the case, we could meet again and take action. So that's my motion is that we ask the library to close the meeting room and cancel all events for the time being.
Yeah.
Do we have a second on that?
I'll second it.
Okay. At this point in time,
Does the library, Maureen, do you have anything would that be okay with you? Do you have something, would that work with you and your board? Just want to make sure that we are all on the same page.
That would be okay with us to do that. We would request your advice on a new program that we just started. We started a very popular outdoor Couch to 5K program that has close to 50 people registered. We just kicked that off last night, and about 20 of the 50 came. So that would be the only activity that we have that's going on that.
is it possible to have those meetings outside? Is that
Yeah.
something that
It's
has
intended to be
inside?
outside.
I think the risk goes down quite a bit when you're outside rather than inside in a meeting room. And so if we were to talk about canceling the activities in the meeting rooms or inside the library, would that be an okay addition to your motion?
Yes, but what exactly is this program?
It's a walking and running type fitness program.
Okay, so I don't want a pack of 20 people, if they're spread out, just as you walk down Main Street or whatever you do, that'd be okay. But the danger comes when you have a program like that and everyone gathers together to get started. So if you say, it's a 6 o'clock thing, if people come and start on their walk at 6 and somebody comes in at 6:02 and somebody else is at 5:58, that's fine. But if you wait for everyone to gather together, then you are creating a risk.
One other way that they might be able to do that, and you can comment on this, is that when they're gathering, if you encourage them to spread out over the entire lawn and do some stretching and maybe maintain a 6 feet distance between them while they're all getting together, it might actually work with that. You may have to take some precautions that make you think a little bit differently about how do you actually keep people a little bit more separated. But I think that something like that, I'd be fine with allowing to continue.
All right, so we'll restrict this to within the library building.
Yeah. So all those in favor then? Aye? Great, thank you.
Thank you. And we will also spread tables out further inside the library and make sure that we have the appropriate social distancing to
That
keep
sounds
people
great.
apart.
If you could get a sign somewhat similar to what Alma has, that might be good
I'll
for
do
posting
that.
by the entrances.
Steve's going to send it to me.
So I just at this point want to thank everyone. As we start this process, we are learning as we go as to the best way to approach it. I hope that we can tackle some of these issues a little bit more quickly. This one took a long time, but I think as we get into the groove here, it should go a lot quicker. So at this point, should we go back to the schools now? And now that we've kind of thought through at least one issue?
Sorry, excuse me, Sarah Dulay, Chair of the School Committee again.
Please.
The board here has actually just heard Superintendent Bach's recommendation this evening. So since it's a public meeting, and we have on the agenda action and discussion, so would you entertain allowing my board to make a motion? And
We'd actually love
Okay.
the opportunity for you guys to chime in on this. Yes, so
Okay.
I'll hand it over to you.
Thank you. So Everyone remembers what we, okay. So I guess I'd be looking for discussion and a motion to accept the recommendation of Superintendent Bach, and that we could reconvene after guidance from the governor and the State Department of Health and this Department of Health by Wednesday or Thursday of next week, as you recommended. So that would be the motion that I would be looking for.
I make a motion to accept the recommendation by Superintendent Bach, as she stated earlier.
I'll second it.
Thank you. And then I just open it for discussion if anyone had any comments or concerns or.
I am hoping that we would utilize our alternative learning days to at least utilize the time so that we have students who are at home with the possibility of being educated as best as we can, not as a replacement for being in school, but at least to the best that we're able. Since we have the platform in place, it seems like that might be a possibility. I also wanted to bring up, since we voted in April for utilizing alternative learning days as a way of dealing with snow days, checking to see if we need to vote to approve alternative learning days in the event of any unexpected emergencies throughout the year.
I don't believe it was just for snow days. It was for unanticipated events that would prevent us from coming together to school, but
I did look back at the April 24th minutes just to see what we actually voted on. There was not a limit on the number of days, but there's a discussion around it specifically about snow days. That's why, I mean, I don't know that it's necessary, but there wasn't a limit. There was discussion at our last meeting that perhaps we were limited to 2. There was discussion of it, but when we went to vote, we were not limited to it, just so you know.
I think, I mean, I certainly would accept a motion if you feel it clarifies, and I would defer to the chair. I guess there's certain pieces I want to be clear about, which is we need time to step back. We need to call our union. We need to confer on the implementation of how long we're going to be out. So I think until, my recommendation would be that Daniel and I have been over here kind of conferring, trying to plan. I think until we hear the governor's recommendations at and Director Riley and Commissioner, and we talk it through, what they're thinking long-term, how we apply a combination of no school days and ALD needs to be determined as a package. Because I think we also have to look at, are we bringing in some employees to do meals? Are we, like, we need time to plan. So again, the purpose of recommendation to accept a week with the schools closed while things stabilize in terms of recommendations allows us to be really thoughtful, builds confidence into the decision-making that we have in place with our families. While it's a burden that I think also causes stress to a whole other crew of families with regard to daycare coverage, all the things we've mentioned. But I think the opportunity to get clear information. So I see us utilizing some of our ALD days, but not all. I think people need to understand that we will have days to make up because we have 4 snow day spaces available. So we could take 4 days next week and just take them off and push to that 185th day. And then if we need to be closed beyond that, leverage ALDs. Like, we need to sit down and come up with a package. And we'll bring it back to you as further recommendation, and you're gonna need to think about that. But for now, until the information stabilizes and we have some sense about how long we might be closed, that's part of the decision. So I think a recommendation that we utilize some of them is one I totally agree with. I'm not sure where they're going to be applied until we can pull the leadership team back together. So if you wanted to do a motion to apply them outside of snow day, I think that would clean up your minutes, so I would agree.
So just for my understanding, so we are planning to close for next week, and anything beyond that, we'll be thinking about applying alternative learning days for that.
We might utilize a plan for some of them next week, but we need to step back and talk to faculty. We need to look at the application of the week and think about it as a package. So I'd rather not have people hear misinformation from us that Monday's going to be an ALD day until we like have a breath. Like we haven't even told our faculty. So, you know, I think in terms of like order of operations and respectful discourse, we need to talk to our faculty first, let people know, and then come up with the instructional plan next. So that's kind of where I am.
Right, we still have 4 snow days, and the governor has now said that no school is going to go past the 185th day. So we do have days to utilize and make a plan. You don't have to.
I just want to acknowledge that I know a lot of families are fearful, and there's so much more to closing the schools than just closing the schools and sending kids home. As mentioned before, lots of our students rely on us for meals and services, and we're carefully considering our staff and the implications for their families and financial implications. Our bus drivers won't be getting paid if they're not driving a bus. So there's a lot to go into closing schools. And if our recommendation goes through and we are open tomorrow and then we go ahead and close next week, I just want to reiterate that families are under no obligation to have to send their children to school. So if you're feeling fearful or you just want to be very protective and not send your children to school, you do not have to, but we will be there, we'll be open, and we need that time with our staff and our administration to come up with a thoughtful plan so that we can care for our students and take care of everybody when we actually are closed for an extended period of time.
Thank you. Any further discussion, Lisa? So we'll take a vote on the original motion of accepting that recommendation. Okay, vote. All in favor, 4-0, thank you.
And one member not voting.
Well, he's not here.
Yep.
And then, do you want to talk about the alternative learning days now? I'm fine with waiting, given that we have the snow days, until we're going to have to reconvene next week anyway. I'm anticipating the governor tomorrow morning. I don't know what, I haven't talked to the governor, but I'm anticipating some guidelines tomorrow morning at 8:30, and then I think after that I can talk to Amber, and then we can make a plan to set up a meeting for next week.
I wouldn't mind voting now, so that in case there's any, inclination to begin immediately, if the staff so chooses, if the leadership team chooses, we at least have it in place.
Okay, so make your motion.
Okay, I make a motion to continue the pilot program for alternative learning days for this year, specifically for the purpose of unexpected emergencies.
Okay, great. Anyone second?
I'll second it.
Okay, any further discussion on Lisa's motion? All right, all in favor? 4-0, thank you.
I think that's a great recommendation. Thank you. That gives us the flexibility to move forward. We'll convene the leadership team tomorrow. We have a list of kind of communications that'll go out. You'll be CC'd in on all of them, so we'll take first steps.
Thank you. We appreciate you working
Thank you
through
for the
all
side
of that.
meeting.
Said you are.
So, yeah, I just wanted to, and correct me if I'm wrong here, Dr. Ehrlich, I just want to make sure that the community realizes, unless your child is immunocompromised or has otherwise confounding medical conditions, the risk of a child based on the experience in China, the risk of child contracting COVID-19 is exceedingly low. That they're vectors for transmission, but the likelihood of them actually getting profoundly ill is, unless they have is exceedingly low. Am I?
That's correct. And so I want to be clear. It's not that they can't get infected. It's like, what does infection mean?
Exactly.
It's viewed as either something very mild and not noticeable, or just like a typical cold in the younger children.
But they're transmitting.
They transmit it. The population at risk are people with chronic lung disease, chronic heart disease, anyone who's immunocompromised, such as a child who might be getting chemotherapy, or if they have certain immunodeficiencies from genetic diseases or acquired diseases. And then, of course, people over the age of 60 or adults with any of those conditions that I mentioned.
And since we're meeting, and since we can't do this without you, one of the things I was going to ask as a board and looking to Steve is that, as we go through this meeting and we summarize, it would be helpful to coordinate with the various groups in town so that we have like a one-page communication that we can send out, which has all the consistent messages, whether it's about the library, whether it's about the school, or whatever other decision that, whether it comes through the town manager or it comes through the Board of Health, it would be, and it's kind of as simple as we can make it and as spread it out as widely as we can.
Yeah, one thing we can do as the Board of Health is, we can either approve the recommendations that some of these other boards have already made, and so that way they're all coming from the Board of Health as well, or we could let individual departments within town to try to organize it amongst themselves to kind of put out this one-pager. I'm not exactly sure what's the best, but I think having Board of Health guidance on some of these things, that actions that they're taking might be useful as well.
Christy's looking to.
I was just going to say that, we always coordinate on that type of thing. So, we have been in very close contact in terms of this whole pandemic. So, but certainly if the Board of Health wants to vote on it, to give your support, I think that that's helpful too.
Is that something that we'd like to do here? So I'd like to make a motion that the Board of Health approve the recommendation that the school board has given to the school department.
I would, if I can modify that, I would say endorse.
Endorse, sure.
I don't think they need our approval, but I would endorse that.
I accept that amendment. So that we endorse their recommendation is consistent with public health here in town.
I'll second that.
All in favor?
Aye.
Excellent. Well, we're still we're finishing up here on schools. I just had a question. I may have missed this, but I know that the schools, as being part of the community, do allow for non-school events to happen in the schools for groups within the community and all of that. I guess the question to the school committee and the school department, I guess the Board of Health, any thoughts on activities that may have been or are planned within your school properties by outside things? Are those?
So
Actually,
typically.
Before I hand it off to you, I just want to say that I'm aware that some things have actually already been canceled in terms of activities. The school department has actually been very proactive in terms of looking out for the students. And so with that, I'd like to turn it back over to you. So
I'm thinking like things like if Boy Scouts or Girl Scouts or garden clubs or whatever have.
Well, typically
when,
that's a great question. Typically when the schools are closed, they're closed for other activities, so we'll put out notifications for next week. And then, again, it's town organizations that access our buildings, so we'll coordinate with them, all Westborough community organizations. So I think as it evolves next week and you continue to look at it, as Dr. Ehrlich has said as well, you'll need to give us parameters, like if it's a Brownie troop and it's 8 girls, can they get together or should they not convene? Like, people are gonna continue to seek guidance from you as this extends over months. And I think certainly if there are guidelines and recommendations, as Dr. Hashmi said, we're happy to push out those notifications to our groups and families and communicate with them to keep a flow of information for guidelines. I think your consistency with the libraries is helpful, like you've canceled activities, but it's open. So, I think we're just gonna need to keep coordinating. We don't have any activities now, I think, through the start of mid-April that we won't have canceled. And I mean, the majority of it is recreation. They've just finished basketball. So we'll just keep coordinating on and looking at it case by case and call if we have any questions. So
we have a hand in the back. I think that's John Arnold, probably about town meeting that may, in fact, you. Yes, in fact, if we are done talking about, maybe do we want to talk then about other activities that are going on?
I just think the last thing is the plan for next week in terms of, obviously we'll have more information, is the plan that Steve will coordinate with Amber and will consult with us as needed. Are one of us going to be participating in any way? I just want to have clarity as to what support is helpful.
As Christy was saying, I mean, I think I've talked daily multiple times with Steve, and I would take his guidance, so I would defer to him.
So I guess it would depend upon whether the board wants to vote on an order after you have some, to continue or whatever you want to do. So you may want to have a meeting scheduled, for next Wednesday, Thursday. At that time you'll know more information and you can make decisions.
Probably good,
Yeah, so I agree. I think having a meeting after you have met and we've gathered the data from, first of all, what the state guidance is, as well as what's happening with other communities, and then we meet again. That
Yeah,
makes
I think
sense.
also that this situation here in Westborough is evolving as well, and what is happening here in Westborough today may actually be different 1 week from now. And so I think that having something on the calendar, a scheduled meeting with the Board of Health, it might be a very quick meeting, but having it on the calendar is probably worthwhile.
Do you want to do it on Tuesday, or is it too late?
I think
Too early.
Too early.
some time, because we would need to have a set of clear recommendations in terms of requests. That we would be, I mean, typically, I would be working with Steve to say, if we were to open, what are the range of types of boundaries that we're trying to set? And so I think we need time to
I'll have
organize
Steve
it.
try to pick a time, but it might be Thursday.
Yeah, why don't we, Amber and I will talk, and then, yeah, I would say Wednesday at the earliest, Thursday at the latest?
Yes,
So is
that
that
sounds
like,
good.
Yep.
so Wednesday or Thursday?
Yeah.
So we did want to entertain whether we want to make a motion about other activities at the school. I know the school has said that there are no other activities, but do we want something in place as a recommendation there or not? And I think, Syed, you wanted something about the size of gatherings.
Yeah, why don't we, because that's the discussion that we were having at the Board of Selectmen. I think that's the discussion, I think, because, start with that. So I'm actually okay with my chair's, just ask him. So, Selectman, Chairman?
Yes.
Correct me if I'm wrong, you were going for 25, that's okay with me.
Yeah, and that was really off what the governor in his
Right.
press conference said was group
Right.
gatherings, but I'm not, I throw it out there, I really look to you as more experts on the medical side, whatever, as to what, and I think some of it may also,
Commissioner, I guess.
if you're in a room like this, 25 may be small because you can do social distancing. If you're in a room that is much smaller, you may not even want 10. I don't know. I mean, but I think that.
At least the number should be, I think if we, so the reason I'm focused on this is, one, I think it's important to have a number. I think the chief is right. It focuses our attention. The other thing, and I don't know if it's appropriate now to discuss this, Nathan, is the problem is there are also religious groups that are going to be meeting, and I don't know if they're going to be taking our guidance or not, but I think that is also something that we need to, go ahead.
We do have actually a fairly packed agenda of stuff that we would like to talk about. I would like to address that. I do think that I might ask that we table that for a little bit later. And one of the things that I really would like to tackle is the town meeting, and that is coming up.
Can I also put in that town elections too?
Yes, we can tackle those probably at the same time.
So I do think, first of all, that any number is arbitrary, that, 25 is not magically better than 26, for instance, or worse than 24. And so these are, people pull out round numbers because it's easy to work with. So that being said, I've seen in other guidance documents 50 as a number. I have not seen anything higher than 50 when there's been an attempt to restrict the size of gatherings. So some of that may be dependent upon the size of the venue has been mentioned in the room and the spacing and things like that. So that's why it's a little hard to come up with a specific number, but,
I mean, could we take another tact, which is encourage spacing, but what about the option of, from a town perspective, of canceling or postponing all non-essential
I think
meetings?
that's fine, yeah.
That might be an action that the board may want to take. So I think where we can, let's postpone them. I mean, if they don't have to meet, I mean, there are in town government, as we know, school committee, board of selectmen need to meet, board of appeals needs to meet, planning board has public hearings. So there are some essential, and we'll work with making sure that we provide enough spaces. But I think where there are meetings that are non-essential, I would love to have a recommendation from the board to.
Yeah, so I think at this point in time, I think the board is actually in favor of essential meetings taking place. We're not saying that we need to cancel things that are essential. As far as non-essential meetings, I think that, and I'm speaking for the board here, I hope, they'll correct me if I'm wrong, is that non-essential meetings, if they don't have to happen and we can reschedule them or we can do them remotely, that would be advised. It doesn't necessarily mean that every non-essential meeting has to be canceled, but I think that we would recommend that when they could, they probably should be postponed.
So I agree with that. I do have a question which has to do with open meeting laws. And I know for our board, we can have one person be remote, but we can't have all of us be remote. And in fact, the people who are in attendance have to vote to authorize a remote allowance in that instance, as I recollect. So what are the limitations we have if we want to encourage remote meetings to take place remotely?
You're correct. So you have to have a quorum present. And so that's why, as you just described, you have to have two and you can have one remote. So currently that's how it would have to operate, is where you would have to have a quorum present.
And is that a state regulation, or do we have any ability to override that?
No, that's the state.
So going back to, I'm personally in favor of also having limiting the number of people. So you guys don't want to vote on that? Am I getting that correct?
I think that a hard limit is something that is, Dr. Ehrlich had said, is a little bit arbitrary.
Do you have a number you want to suggest?
25.
And do you want to provide a rationale, or just it feels good?
And
It feels good.
I do want to bear in mind that there are things like elections where there might be people that are in that building altogether that add up to more than 25, or there might be a town meeting that we're having that is going to have more than 25 people if I can base it on prior town meetings. So we may have to be careful about the wording that we choose here with how we want to
Maybe we
phrase
should
this.
wait then. Go ahead, Chris.
I just wanted to add, so like the library where we can't sort of close at a number, in a public meeting, you wouldn't be able to limit the number of attendees.
You know what? You're right. Sorry. Maybe we should just focus on essential and non-essential.
Yeah, I think that.
So I'm going to make a motion that the Board of Health recommends non-essential meetings be canceled or postponed, and that for essential meetings, adequate spacing of seating be provided in order to minimize risk of spread of coronavirus.
Could we add that if a meeting can be done remotely, and not all can, but in the case that they can, I don't have any problem with those meetings going on. I wouldn't necessarily want to recommend that we cancel or postpone those ones that can be done remotely.
Okay.
Not to complicate things, but do we have a definition of essential versus non-essential, or an idea of that? So we're going to get the question.
So I would, for the purposes of the motion, indicate that the determination of essential or non-essential is at the discretion of town manager and department heads.
I'm okay with that.
Yes.
So do we have a second then for that motion?
I'll second it.
Okay, all in favor?
Aye.
Aye. So now actually I would like to talk about both the town meeting and the
Thank you very
town
much.
elections. Thank you for
We
coming.
look forward to the ongoing conversations we'll be having. So thank you very much.
So John Arnold is coming up, if you can introduce yourself, and
Wendy as well for the town
And Wendy as
elections.
well, excellent. I'd like to hear from both of you before we actually progress down this front any further.
Hi, I'm John Arnold, Town Moderator.
I'm Wendy Mickle, Town Clerk.
The election happens first typically, so I'll let Wendy go first.
Okay. So the election is this coming Tuesday. It's a choice to go, whether you want to or not. You can also get an absentee ballot, so we've kind of been hyping that up. If you want to, if you can't get to the polls on Election Day, then you can do an absentee ballot. They'd have until noon on Monday. Right now, there's 135 that were mailed out, 12 have come back. I don't know how many more will come back, but, so that's a choice that they still have, that they could do tomorrow and they can do on Monday.
And they can come into the office
And
and
they
fill
can
it
come
out
into
there.
the
and
office to do
hand it
that. Yep. Right now, I think because you don't have to go, well, first of all, if you've seen the ballot, there's 11 races or 11 openings, and there's 11 people running, and that's it. So anybody that gets their parent or kid or whatever to go to the polls and vote for them, they win. So I don't know, I'm not trying to diminish it, but that is what it is. And so I don't think
And
there's...
just to clarify for those people that might not know, the elections are actually being held at the senior center.
They are.
And so obviously that is an at-risk population. And so anything we can do to help, not spread COVID-19 to that population would be helpful. So if people thought they might be sick on that day and would rather early vote, that would be one mechanism that they could do to do that. Hand sanitizing, as long as we have the hand sanitizer.
Well, we do plan to clean all the booths and clean everything in the facility, and I know that it's closed for activities at the senior center. So it's really just there for the election that day.
So there won't be any activities going on at the same time.
That's my understanding.
That is good.
Okay.
And Wendy, correct me if I'm wrong, isn't there, I thought there are legal reasons that you can't close,
Well, we can't cancel an election. You would have to get a court order or the governor to allow that. So, I mean, we could do that on Monday if something came up and we needed to.
Yeah, I think if I can, just to that question, there is, town council did provide us a motion that we can, that if we decided that it made sense to postpone, that we could act on that tonight. I don't think we can wait till Monday because we don't have a meeting posted, so unless it was considered an emergency action, but I don't know that it would. But I think, not to change the discussion, I think, but there is, just to answer the question, is if the decision was, we do have a motion that's been drafted by legal counsel that would allow us to delay and reschedule the town election.
So my own feeling is, in the absence of any cases in the town of Westborough so far, that would be an extreme reaction to try and postpone the election. I do think it is imperative that the message get to the election workers that they not show up if there's the slightest question of them being ill.
Okay.
And the same goes for the voters, yes?
I actually would like to be very careful and not to discourage any voter from coming and voting. If you think you might get sick, I would encourage you to early vote.
Right.
And the issue with the voter is much less because you come and you're there for a very brief period of time. But if you have a poll worker who's there all day long interacting with lots of different people, that's a different story.
Yeah. A question for Wendy. Given where we are today and the number of people who volunteer and work the polls, do you see any issue of them not wanting to work and not wanting to help staff for the day? Are you going to be short-staffed?
Well, I have 40 people that I need to work that day. And so out of the 40 that I started with, I lost 20, and I've replaced about 18 of them. So I still have a few openings. But mostly everyone that felt that they were either their immune system was down or whatever, they didn't think they should go or be there. And most of it was our older poll workers. So I have younger ones.
I know I did talk to the town manager, and I think if she could maybe comment.
I was just going to say, so we did meet with Wendy earlier today, and so if there are people who are uncomfortable being poll workers, we're going to ask staff to help with the election. So we do have staff that we've identified as being able to spend some time over there to help with the election.
Thank you. So unless there's more discussion, I mean, my feeling is, I think, similar to some of the other people that have spoken, in that the election should probably just go on. I see some nods, so if we can, I'd like to actually take a formal motion on that. I know we probably don't need to, but I'd like to make a motion that the Board of Health, endorse the elections going ahead as scheduled.
I'll second that.
Okay, all in favor? Aye, excellent.
Thank you.
So now, John, if you want to talk a little bit about the town elections. I know that you just talked about it last night at a different meeting, but
That's right, that's fine. I still have my same notes from Tuesday night and actually been digging into it a little deeper. So we are fortunate in a couple of ways. First of all, unlike the election, it's Tuesday. We have a little over 2 weeks to decide, or at least before the town meeting happens. I'm intrigued by the fact that the schools are closing next week, but there's going to be a follow-on meeting. So I'd like to be included in that meeting, and if you could have it in the evening, that'd be great, if not as soon as we do that, because obviously the meeting has been posted for the schools, and if the schools don't let us in, that puts me in a rather awkward spot. So following in, I understand that the issues are, is the situation so severe that we feel we need to postpone town meeting, or is it that we just need to be extra careful? And we can defer our decision because we have the 2 weeks of time, but I don't want to defer it too long because I think people should be warned that if we think there's a need to postpone town meeting, telling people early enough is a good thing. Yes. So the two options that have come up is that if we want to stick with the social space argument that it's not so severe that we need to postpone, but that we want to give people more space, the warrant by the Selectmen has been posted for both the auditorium and the gymnasium. In the past, we've used the gymnasium as overflow. It's much bigger. The acoustics aren't quite as good, but the good news is there aren't fixed seats and there's lots of bleachers. And the reason we've typically had overflow is because we've had issues that have brought out, more than 1,000 people. Our typical annual town meeting, a Saturday is probably 200 or so. Whether it will be more popular this year or less, we don't know. But certainly it would be much easier to spread out the expected crowd of 200 or so people in the gym, and we can work on a density graph if we wanted to see if that were possible. Because the good news is people could either spread out in affinity groups, husbands and wives could choose to sit together, but if you didn't know somebody, like Wendy and I could move like this if we wanted, because there could be folding chairs or space on the bleachers. Again, I'm looking for guidance from the medical and health professionals to help make a decision. But my belief is, given where we are now, that if it seems to the point that the recommendation is that there's no need to postpone the town meeting, then I would suggest that we have it in the gym and we just make efforts to have the folding chairs out if people want to bring wipes and wipe their chair down, and then ask them to spread out in a way that sees fit. So that's one way to handle it, or at least we're not in the relatively fixed confines of the auditorium. The other good news is that there is a guidance of a state law that can guide our path if we decide that there's a public emergency that makes us want to postpone the town meeting. So Chapter 39, Section 10A, I'll just read a little bit of a quote, says that in the event of a weather-related or public safety emergency, the moderator shall consult with local public safety officials and members of the Board of Selectmen, and then upon the moderator's own declaration, the moderator shall recess and continue the town meeting to a time, date, and place certain. So the one clean way to do it, such that the town meeting doesn't even have to be called into order, because the state law says that I can do this in consultation, and even I wouldn't have to show up on Saturday, March 28th, and then say, okay, well, let's go home. So again, the key parts here is that there isn't a vote. It's a vote of me. I decide. But the check and balance is that I consult with local public safety officials, and in this case, I consider the public safety officials to be, typically this law was written expecting it to be police and fire, but here I consider Board of Health, police, and fire to the ones to provide the guidance, and then I also consult with the Board of Selectmen. So my goal is that as we learn more and find out, A, whether the schools will open the doors on Saturday, March 28th, and B, whether the safety and health personnel recommend postponing, it would certainly be great in terms of allowing Wendy to work with our electronic voting vendor to say that they have enough time to know they can plan around showing up on the 28th. I think it would be great if we could reach a conclusion, barring, obviously situations can change, by the end of next week, because that would give a week for me to make a declaration and to let people know. The caveat is that if we invoke this law, I would have to continue the meeting to a time, date, and place certain, and the date has to be within 30 days. And so the tricky part, again, trying to be fair to all voters, because we could certainly, is that it's 30 days from the date I make the declaration, not 30 days from the town meeting. So the later we go, the more leeway we have. But obviously, as we move to 30 days out, we hit Patriots' Day weekend. We would have to wait almost right up until the day to make it the week after, and it could be that perhaps trying to avoid Patriots' Day weekend, moving it up 2 weeks, is we still don't know. Now, the good news is the consensus of the other moderators who see this law don't see a problem with the law being invoked a second time. So if there were still a public safety emergency at that time, date, and place certain, then theoretically, could make another declaration, move it on another 30 days. So that's one way of doing it, and I'm hoping we have more information next week, because I was hoping to not have to make that declaration until I can confer with the schools as well as you. Another way of proceeding that's got a little more risk, and I use the word risk in sort of scare quotes, it could be, because we do not have a quorum for our regularly scheduled annual town meeting, it could be that we as a community decide that it would be great to postpone the town meeting, but we don't want to invoke this law. And if that's the case, then the clerk and I are required by law to essentially be at the meeting to call it into order. And we could call it into order, and if somebody made a motion to recess, then the meeting, at that point the meeting is started. The meeting is under the control of the voters, where I'm presiding over the parliamentary aspects. The risk of that is that if 20 people showed up and somebody made the motion to recess and 11 of those people said, nope, we're here to vote, let's go, there really isn't recourse. And it would be very difficult for me to be in a situation to say, I let this meeting happen, what's changed now to suddenly call a public emergency only because people didn't vote. So it puts the town and it puts the voters in an awkward situation. And then the third point of risk that I'll mention is that in normal times, town meetings are expected, and in fact required, to have held their town meeting by June 30th. So if we think of this cascading 30 days, theoretically, the town budget goes away on June 30th when the new fiscal year starts. Now, certainly there's already discussion at the state level about whether the legislature could enact some emergency legislation to allow a continuation budget similar to what the state and federal governments do, where essentially the town is assumed that we could take some percentage of a year or month and spend that until the town meeting eventually cleans it up. So that's what the options are. My belief going forward is that the best thing would be for us to get to follow up on this meeting you're going to have next week, where the schools might know more about their expectation about the schools building being open on the 28th. The health professionals will know more about, is the risk getting better, worse, and then perhaps by the end of the week, having worked with the schools and the selectmen and all of you, find out if we decide we want to invoke a postponement, when would that time, date, and place certain be that we think would be fair to all the voters.
Great, I think that's actually a very comprehensive list of stuff you presented us, so thank you for that. Did you want to jump in?
No, I just, it's funny, the moderator, Mr. Moderator came to the Board of Selectmen meeting on Tuesday, my God, it seems like a lifetime ago. And when you came, I was thinking one thing, and then today, and you asked, you got to the heart of the matter, is what is the risk? And the issue for me is, I think we should wait till we find out where we are. The problem, as Dr. Walsh has pointed out, is that testing has not been done. So we truly do not know, are we at the top of the curve or going towards the top, or are we flattening? So I think as we get more data, I think having a meeting next week, sort this out, and then we can get, I think, Steve, sorry. So
I just throwing something into the mix here. So if indeed we do close the schools for let's say the second week, let's protect the children as far as, being herded together, but I don't know why there wouldn't be a reason why we couldn't have town meeting anyways. It's a totally different situation, and, again, something to think about, I think.
In my concern, the reason I was, two things happened that really concerned me. One, I don't know where, I'm concerned about the testing. We haven't done as much testing as compared to other countries. I do not know where we are. I think by next week we will maybe have more data, and then we can decide if we want to proceed or not. I'm just concerned about having a lot of people. Granted, there will be social distancing. I'm concerned about congregating people in the midst of a pandemic, of which we still do not have all the information together. So I'll just...
So I'd like to jump on that and maybe take a counterpoint to it, and that's that if we look at other countries that have been affected, They typically start out with a few cases. The cases rise. There's usually a period of kind of doubling that goes on in the number of cases that are present. And it appears that China, after 3 months, is now at the point where there's actually fewer cases that are coming up now than there were in the midst of their kind of exponential growth. I would imagine that right now here in Westborough, where we really don't have either any detected cases or very few actual cases in town, that we will also go through a period of, larger number of cases being detected. And so I just want to throw out there that we would like to have the town meeting at the safest possible time. And the question is, when is the safest possible time? It could be that the regular scheduled time might end up being the safest time to have it in terms of the least number of cases. I think that if we were to delay it, and we start getting into June, I mean, maybe we'd be in the point where things would be coming down. But we might still, I mean, if we look at the number of cases here in the US, I think that, there's still about half the cases, maybe that's in Massachusetts, about half the cases are still in the situation where people are infected and only half of them have resolved. And so we could be in a situation where we go through this large period of time where new cases are identified, those people are still infected. They may still want to vote. And so pushing it off might mean that there might be not very many new cases, but there could be existing cases that are still, that we would recommend they isolate themselves. But we are talking about functioning government, having the government continue to operate. It's one of the essential duties of the town is to make sure that we continue to operate. And so we may want to figure out not just, is this a good time to have a town meeting, but actually take the more proactive step of trying to choose when is the best time to have a town meeting. I don't know if you guys have any comments or feedback on that.
So I think your comments about sooner rather than later might actually be safer is certainly appropriate. That may be true. I think it's an unknown. I do like the notion of in a week we'll have some more data and we may be able to know some trends. The one question, it's my bias in how I think from my own experience at town meeting, but my bias is that the people who attend town meeting tend to skew to an older crowd, and that would be a more at-risk crowd. That's the one, that's the biggest concern I have.
Yeah, we don't obviously keep demographic information, but I think what you'll find is that the town meeting regulars who are there article to article tend to skew probably, toward middle age or older.
Yeah.
John, can you just talk into the microphone a little
sorry,
bit better?
Sorry. My loud booming voice not working. But then there are cases where if people are there to vote on the budget, we've actually seen, the big item that usually gets the most people is the budget, and then you get a cross section because there are some people there for police, fire, schools, or whatever. And I think what I've seen, and Wendy looks out at the room probably more than I do in terms of looking at the crowd. I think the Saturday afternoon is probably the most diverse, and then as it goes on, it probably tends to be more the town meeting regulars. Probably Saturday night or whatever, and the other piece of good news we have is the warrant's relatively short this year, so that would mean that at least it should be not as long as some town meetings have been in the past.
So given the options that you had laid out, I do think that the best one is for you to make an emergency declaration if we come to that.
Yeah.
And I think that in a week, the situation will be clearer.
Right, yeah, and that's why I'd like to participate. I think part of my first step in thinking about this was Tuesday. My next step was here. If the Board of Health is going to have a meeting with the schools to just see how things are, please invite me to that. So I can go, and I think then we'll either know at that meeting or I can have phone conversations with Chief Purcell and Chief Laurie, you and the Selectmen, and hopefully, by the end of next week, decide whether we're at a point where we can make the decision or if we should, wait a little bit. And I'll also confer with Wendy to find out how much lead time our electronic voting people need to know to not show up or not. And we also have to check with the schools about availability as well.
Do you want Amber to speak?
Yeah,
or do you want to
Amber,
speak?
I was going to say, I don't anticipate any problems with the physical building, but you can.
Yeah, two points of clarification. First of all, we're all a municipal set of buildings together. There's nothing that would preclude you from holding town meeting. We're not holding school because we have hundreds and hundreds of students that were then holding together as a captive audience all day. And our purpose, again, was to give ourselves a week to step back and get clear information, clear our protocols, and I'm very hopeful return to school with a set of parameters that can be sustainable over time. So if conducting town meeting is a decision that the board feels is logical and can be managed, the school is available to you, even if it's closed to students.
Right, yeah.
And secondarily, I was going to mention that I know the town manager was working on a variety of creative ideas to shorten town meeting and working with Westborough TV to have us potentially put some of our presentations on Westborough TV, and then we would eliminate the presentations from town meeting. People could view them on Westborough TV. I know she was speaking with Karen Henderson. So things we can do to shorten it, but in terms of, and I would defer, of course, to the town manager and her group to plan for that. We certainly are willing to put our presentations online so that they could be, and answer questions to people as needed. But the school's available to you should it be deemed that you want to hold town meeting.
Right, yes, I thank you for that, and thanks for the clarification. I just didn't want to be presumptive that if the standard policy was if the school was closed, then non-school people couldn't use it. I didn't want to presume that it take permission. It still takes permission of you to say, yes, you can use it, so.
And I heard permission.
Yeah.
Thank you.
So it's sounding like at this time, the Board of Health is not willing to make a motion to make a safety closure of the town meeting or a postponement of that. And that I think our best course of action is to say that right now, the risk in Westborough is low. It doesn't warrant postponing the town meeting. But situations can change very quickly, and that we do have a meeting scheduled for next week, and we will reevaluate and see if we still have the same consensus at that point. And, but at this point, I think we should proceed under the assumption that the town meeting will go forward, unless you guys disagree with that. Excellent.
Thank you.
Thank you. Appreciate it.
Nathan, can I just, sorry to keep going here, but because this thing is fluid, the town manager just did send to the Board of Selectmen that back to one of our previous discussions, that the governor has issued an executive order relaxing the rules around remote meetings in terms of the question around the quorum. So,
there you go.
Listening, or the lieutenant governor was, but I'm not going to go through them here, but it's something that we can look at. It still needs to be an open meeting, so therefore, using technology, if it's we need to allow people to listen in. If it's a public hearing, we need to allow for them to easily be able to interact in that meeting. But again, I know Selectman Edinburgh and I were both just looking at this, but there's a lot of whereases and this stuff in there, but it basically does allow for that without having the quorum present we talked about. So there is some flexibility, so I just wanted to bring that out.
Thank you. So I think the next thing that I wanted to talk about was kind of travel for town employees. I don't know if there's particular other things you want to address first, or that we haven't successfully closed out, but I think we've handled most of the other stuff as well.
Yes, are there policies that have already been enacted that we should know about?
There are not. We haven't put any policies in place. I know that Selectman Johnson had raised the issue of the senior center and the recreation department, so I just want to make sure that those don't fall off your agenda.
Thank you. I'll jot myself a note. Yeah, so with the travel, I think that we're just trying to figure out what the Board of Health recommends in terms of travel. I think that there's actually been some, I think since I drafted these slides, the federal government has come up with some extra travel bans, I think, to Europe and a few other places. And so just trying to figure out exactly where the board feels that we should be. There are things that we could do. Some of these are recommendations. Some might be, the board saying that it's actually unsafe to travel places. And I think we also want to kind of recognize that there are some essential travel that still must happen. There are certain things that, we might have to go and, check the progress of like a fire truck, that if we don't do that, could be problematic in actually getting the fire truck on town. And those are deemed as essential services that we need. And so I do want to just kind of put out some of the nuances so that we can try to figure out if there is a consensus from the Board of Health as to, you know, that we can give to the people in town that work for the town.
I mean, I think the guidance coming from the CDC would be what I would suggest for the town to adhere to, which is it discourages unnecessary travel particularly by airplane. I think if someone's driving a distance to go to a meeting somewhere, you know, if they're going to Albany, I don't consider that travel in the same way someone flying to Chicago would be. And so I don't know that this is something that the board needs to take a vote on so much as I think the guidance should be to avoid unnecessary travel, but that, again, what's unnecessary should be at the discretion of town manager and the department heads.
Yeah, I mean, I think that I might be willing to go a step further. I think that, I mean, banning non-essential travel outside of Massachusetts for town employees, for town business, it might be something that I'd like to entertain. I just don't see that there's a need for non-essential town business out of state. It just puts people at risk that they otherwise wouldn't need to. And so we could either do that as a recommendation, or we could do that as a, you know, an outright, you know.
I'd like to hear from our town manager. What her thoughts are.
Would that impact anything critical that we're overlooking?
No, I mean, I think a lot of our department heads are experiencing the cancellation of conferences that they would have otherwise attended. We don't have a lot of out-of-state travel. I think the one that you brought up with the fire truck is a real situation, and so that certainly would be deemed an essential travel.
So do we want to adopt, I'm okay with this list. Do we want to adopt this?
Yeah, so I was kind of looking at this list and saying that, you know, basically as you move down this, you know, severity hierarchy, you know, it incorporates more and more restrictive policies. And so I think kind of drawing a line that might be right around the ban U.S. travel by plane for non-essential town business. And it would include everything above it, you know, banning international travel for town business and, you know, avoiding U.S. travel by plane, but might not include all the stuff below it, like avoiding town travel, you know. There, we could certainly get, you know, a recommendation that is much more severe than the situation right now warrants. And so kind of as far as where we stand right now, I'd be in favor of kind of drawing that line right around the ban U.S. travel by plane for non-essential town business.
And ban international travel?
Yeah.
So basically it's everything above that.
Yes, and everything above that.
Yeah, so it's two bans and the rest is avoids.
Yep.
Okay. I'm just wondering.
I think that's fair.
Do we want to have the school board vote on this for the school department or discuss with this?
I don't, I'll defer to Amber, but I don't believe that we have any travel planned right now. I don't know. I honestly don't know.
I'm just laughing because I would have to think about what travel I have planned. No, as of now, I mean, I would have to do an assessment if we have any people going to conferences and stuff at any distance, but not typically, no.
Okay, and this would only affect people traveling for a town business. Obviously, if you're going somewhere on your own, it's your own time, and this recommendation that we're about to put forth, or this policy we're about to put forth, does not impact personal travel for personal reasons. This is mostly just about town employees doing their jobs for the town.
It certainly is fine if you want to, I mean, I think we should be consistent. The whole purpose of having our boards together is to develop the consistency of practice, and we are municipal employees, so I'd rather you stay parallel.
Good, so can we have a motion then on this?
Actually, just to hit on, I think school and selectmen, I think we heard from the town manager. I mean, personally, I'm fine with that recommendation from a Board of Selectmen standpoint. Selectman Edinburgh, you okay? And Selectman Hashmi, yep. So we're fine too.
Yeah, it's fine. I mean, all conferences are being
I know, right?
canceled now anyway, so no one has a conference to go to.
Right.
So.
Correct.
It may actually be easier to get your money back if you can say that the town actually has a
you were
policy
banned,
that
correct.
says you can't travel.
Yeah.
Yep.
Good. So then, did we have a second on that?
I'll second it.
Okay, all in favor? Aye, excellent. So I think with that, I think if we want to now move to the senior center and the rec department, we can handle those two issues. Do we have anyone from either the senior center or, oh, Steve,
Sorry,
you want to?
can you just clarify the motion? I'm trying to take notes over here. I totally missed it.
So this would be a motion that the Board of Health recommends avoiding international travel, avoiding U.S. travel by plane for town business, avoiding U.S. travel by plane, and avoiding U.S. travel for town business, and that we ban international travel for town business, and that we ban U.S. travel by plane for non-essential town business.
Okay. You got that, Paula? Okay, good, thank you.
Paul is a professional.
Yes.
So there's, just so we're clear, there's no end date with this. We will have to vote to rescind the thing. Okay.
I think that, yeah, we probably want to keep this in place, and I think that we'll have a board meeting before then that we can lift it. I mean, if we wanted to put an end date in, we could.
I would prefer to wait.
Okay.
Okay. Excellent. So moving on then to the senior center and the rec department, we have some people up front, so we can tackle them in either order. So however you guys want to introduce yourselves.
I just think maybe, I'm Jen Kirkland, I'm the recreation director. I think my list might be a little bit shorter, so maybe we can do rec first, if that's fine.
Okay.
So I assume that will probably be very similar to the library. There were just a few unique things in the rec department that I wanted to ask and get clarification on. So like Amber said, we are finishing up basketball, but there are a couple of ongoing things, specifically tomorrow night. There's a volunteer group that puts together an all-star game that is scheduled and planned for tomorrow night in the gym. Also, there is a pre-K basketball clinic that is due to go on for the next 3 Saturdays in the schools. And plus, we have ongoing men and women's basketball that play Tuesday and Wednesday nights in the schools. Everything else, we do run some programs in the schools that haven't started yet, which we could easily just cancel to be consistent with like how you were canceling library activities. So that stuff, that's school related, so I don't know.
I'm sorry, Jen, can you, what's the thing tomorrow?
It's an all-star game, so we run a pretty big rec basketball league, and a lot of the parents every year get together and they kind of do this end of the year sort of all-star game. So that is how, rec doesn't run it. They were asking me today, and I said I would bring it up tonight and get back to them. So that's due to happen tomorrow night in the gym at the high school.
A high school student level.
Yes.
Okay. And
Yeah.
are these all Westborough students? Or
All
is this a
Westborough, yeah.
multiple
Yes.
town thing?
All Westborough, yeah.
Okay.
And it draws a big crowd.
It does, yeah.
You know, the schools have already canceled the play. I would be in favor of canceling this. It's the same thing, it's the same risk.
And we did sort of not preface that there is a good chance. So if you were to decide to cancel, I don't think that it would become as some big shock to them, because we did say there is a very good chance it could be canceled. You know, you might be canceling all activities from tomorrow on.
I do think it's something that could be, I know we say cancel like for the purpose of here, but like for them, it could be postponed.
Right, sorry.
They could still hold a
Yes,
game like in April,
yes,
May,
absolutely.
June, or July.
Absolutely.
I could ask them, yeah, postpone.
Yeah, absolutely.
Yep.
Do you have a sense as to, I know that some of the professional sports and that sort of thing, they started out with a policy of, you know, no spectators, reducing the crowds, you know, mitigation strategies rather than just a, you know, postponement or cancellation. Is something like that possible? Is something like that, you know, even worthwhile to consider?
I mean, you could consider, but I think it would just take away from it. The 90% of the fan base, especially for that game, are all students that come in to cheer or kind of heckle each other.
So I would support your, if you had a motion that should be canceled.
Yeah, I don't know how to say it, but I would.
Postpone.
I would move to postpone the All-Star game scheduled for Friday the 13th.
I have one comment, then we'll probably let that go.
Yeah, so I'll second that with the caveat until the coronavirus health crisis has passed.
I'm going to be the lone dissenter, apparently, in that I think that right now the risk actually is, even though Massachusetts says the overall risk for Massachusetts is rising, I feel the risk in Westborough is actually still pretty low. I think that a week from now, I'd probably be on board with what they're saying. But I think that for an event tomorrow night, I'm actually not so convinced that it needs to be postponed.
So the reason I think postponing is a good idea is for twofold. One, I think it's sending a consistent message,
that's
which
the
is
thing.
what you said.
Right.
And then the second is, I've been to basketball games. Okay, when it's a popular basketball game in those bleachers, people are right on top of each other. And there is zero social distancing that takes place. Okay, and people are shouting and cheering. Amber, am I saying something wrong?
No, you said exactly the correct thing. I mean, I guess we're all here for the consistency. I mean, I just canceled the play. And
Right.
I mean, weeks and weeks, hundreds of hours.
I'm
I
actually
feel
starting to
strongly
come around
that,
now. I think I'm
the
starting to see the
consistency
light.
of that, either I'm putting the play on and we're running basketball or we're canceling both. I just feel strongly that they're all the same kids. So
And I
if
do
we're
think
not
that
going to be
the-
consistent, then I'm happy to hold the play and social distance.
I do think
So,
that
I'll defer to you as a board, but I think for the purposes of consistency, if we're going to do one, then we do both.
In full
Yeah,
disclosure, that's almost an extra. Tonight actually is the championship game, so they're getting their ending and their closure. This tomorrow night is an extra. It's a great thing for the kids, but really tonight's game is kind of the ending and all the kids go and it's a great time. And this All-Star game just kind of started in the past couple of years, so it is an extra. I mean, I'm sure they would like to still do it if we could postpone it, but I would agree that.
Okay. So I think in light of that discussion, I think that we'll probably have a unanimous vote then. If we can, I think, close that discussion and
But
take
what
the vote
about
now.
the rest? What do you have rest?
So that's tomorrow night's a special event, and then we're scheduled, it's sort of weird, we're in the middle of a 5-week pre-K basketball clinic. We've already had 2 weeks, we're due to have 3 more on Saturdays in the school. And then,
How many kids are in?
so there's 3 actually Tuesday nights as well. So there's 4 classes total, each have 15 kids. But just, to stay consistent, it's up to you.
Can we take each of these separately? Because I think they're very
I think they're all
different
kind of a little
activities.
different, yeah.
Certainly a crowded stadium where everybody's bumping elbows is, a little bit different. So I think on that first one, the finishing the All-Star game, I think, yeah, let's take a vote on that. All in favor of recommending that that be canceled? Aye. Or postponed, sorry, let's get that wording right, postponed.
Cancel for tomorrow, but
Yes,
you
postponed.
looked at in the
Yes.
future.
And I think working with the Board of Health to find an appropriate time to have that rescheduled would be good, yes. And so now, in terms of the pre-K clinic for the next 3 Saturdays, you said there's 4 groups, about 15 kids at a time?
Yep, and just to be clear, so this Saturday, we had a scheduled off day, so it would be the 21st, the 28th, and then that first weekend in April. So those are the next 3 Saturdays, and the next 3 Tuesdays where we would have class. So next Tuesday, obviously, with school being closed, we would cancel.
So the immediate things that jump out to me is that pre-K kids are more prone to spreading diseases. On the plus side, 15 kids in an entire gym is actually not that crowded. But the fact that they're going to be handling the ball back and forth does make me a little worried.
Their parents are there in the gym the whole time.
Okay, and I think someone over here had something?
I just had a question. I mean, we canceled all the activities at the library and closed the meeting room. We've closed the school for a week. In terms of the recreation activities, and I'll say the same thing about the senior center activities, I'm just curious, instead of taking them one by one, why we wouldn't follow what we're doing.
Yeah,
Yeah, I agree.
can we do that?
I'm okay with that.
Okay, that'll move things along a lot quicker then. Thank you for the suggestion.
Well, actually, I would like to do the rec department and the senior center separately because I do want to have an opportunity to hear about issues that might affect seniors that are different.
Yeah, so if we want to handle the rec issues,
So I'll just, any rec activities we'll just cancel from this point forward until we hear.
Yes.
I did have one small question. So a lot of our programs we run in the schools and on our own, which we will easily cancel. But we do have a handful of programs that we run with, like Westborough Tennis and Swim. So those are held at their own facility. And they obviously have their own rules. So would we just kind of cancel everything regardless of where they're run, or leave the ones that are run at outside facilities like Westborough Tennis and Swim?
so the stuff that utilizes town
Town
property
property.
or utilizes town personnel or town equipment, I think would all be stuff that would be, fair game for us to really comment on. If Westboro Swim and Tennis wanted to have an activity, I think there we get into, not in the realm of wanting to ban anything, but we could make some recommendations as to what we think is safe.
Well, I guess the question, these are town-sponsored,
So we say, yeah, hey, do you want to take tennis lessons? They're held at Westborough Tennis and Swim.
so it is a town-sponsored,
So that it's just-
registered event. It's just, it's similar
Held somewhere else.
it's similar to when they do golf lessons.
Right.
We don't have, we have to use the town golf course. In this case, for tennis, they use the Western Tennis and
And
Swim
really, there's no difference in terms of risk, whether they are playing basketball in a, you
gym
know,
or there. I think
Mm-hmm.
it goes back to
court or
consistency of
over in
activities.
some other,
Physical
you know,
building.
place, yeah.
I would say maybe it's not the physical building that they're in, but the activity.
And it's still town liability.
Town liability.
We'll just cancel all town activities.
All town rec activities until further notice.
Okay, and sorry, one more thing, but I think I already know the answer. So all of the youth sports that play outside, youth soccer, lacrosse, have all emailed me yesterday saying, what are we going to do? Should I just kind of hold them off with the same thing that Amber was saying, where MIA has postponed or held off school games until March 30th, and then we'll kind of reconvene and we can give them a better answer after that, or?
Yeah, I think that's a good
Okay.
idea.
Perfect.
Thank you. And so should we take a vote on that?
Sure.
Okay.
Go ahead.
All in favor? Or do we have to?
I think you need a motion.
Okay.
So
you wanna make a
I
motion?
move that the town rec department cancel all activities, town-sponsored activities until further notice, and that related youth sports activities be canceled through the end of the month. And we, until further-
Reevaluate.
We'll reevaluate at the time.
Okay.
Thanks.
All in favor? Aye. Excellent. So then we now have the senior center. So let's hear a little bit about you. I know that they provide a lot of essential services to this population.
Sorry,
What?
he was.
All right, because I'm getting the question. So
Yep.
Private events, obviously Jen is going to tell those clubs to wait till March 30th because they're probably taking place on our fields.
So our fields are closed.
Correct. So is there a recommendation you want to give? I'm getting questions from other facilities that are not owned by the town. Obviously, is it just a strong recommendation? Do you have any thoughts on that? Because I'm getting those calls already.
Are you saying if one of the sports clubs in towns or one of the, some private facility is calling, asking for advice what they should do?
Correct.
I would be in the same, I think we should be consistent across the board.
Well, yeah, but you'd have to order them to not do it, so.
So I'm not in a position where I feel like we need to order, let's say, a gym to close their gym for people that want to show up. And so I'm not quite ready to go that far, and maybe the other members of the board are, but I think that in terms of making a recommendation that they keep appropriate space between people, and so it would very much then depend on very much the situation that you're in. You could imagine some places where they're packed in, and we would recommend that that not happen, and that they would cancel any activity or find a way to spread people out. And I do think activities outdoors are a little bit safer than when you pack people in together into one physical room. I don't know.
Yeah, I agree, and I'm not in favor of advising private businesses to stop providing services. I would encourage any business that has a lot of people coming through to step up their cleaning and sanitation activities.
Okay, thank you.
Do you have anything to add, Syed?
No.
Okay. Okay, so now back to the senior center then.
Okay. Excuse me, I'm Alma DeMonch. I'm the Senior Center Director. It certainly is my intention to be consistent with the decisions of the boards at this point, and I don't have a problem with canceling any of our daily classes and activities. As Ian did mention, we did cancel our St. Patrick's Day party at your recommendation from Tuesday night, and we've also canceled breakfast with the chief for tomorrow morning. However, it is my intention to maintain some of the support services that we provide for our seniors in the community. I've spoken with a boatload of people the last couple days, and I can report back that we will continue to deliver Meals on Wheels for as long as they're sent to us. It is the intention of Bay Path Elder Services, who provides our meals, to also keep sending them to us as long as possible, and there may be a staggered delivery, like delivering 2 meals one day and, you know, kind of staggering it out that way. And also to either do frozen or shelf-stable meals to fill in for weekends and such. And we've also making arrangements for the people who come for our congregate lunches on Monday, Wednesday, and Friday. If they so desire, we would also put them onto our home delivered list. There are a couple people that I have concerns about that I would encourage to do that. And then there's some others who, you know, not so much. Our twice-a-month caregiver dinners, that's really to be determined at this point. We will continue to make every attempt to cook and deliver those meals. All the cooking is done at the senior center. The delivery is done by volunteers, and but I think that that's not necessarily something that if it became an issue or there were clearly some difficulties with that that's not an essential thing. It's just a really good thing that we do. We have had a couple of our volunteers ask not to do medical trips anymore. However, that being said, with a lot of the doctor's offices canceling routine appointments, we may be okay, and we may just refer people back to their families. There was a question about transportation. Currently, we operate 2 buses on the road every day. It is my intention, as I'm sure that our ridership will decrease some as people stop going out, that I will keep 1 bus on the road every day, all day, just to have, you know, a bus for transportation. We'll continue to do grocery shopping and medical appointments if people so desire. We also have stepped up additional cleaning protocols for the bus starting this past Monday or Tuesday. So the buses are being taken care of. There was a question that Christy brought up to me today about the property tax work program. We've placed 57 people in municipal and school departments. I think our biggest concern was the school. We only have 5, 6, 7, 8 people in 3 schools, so it's not like we have a huge number of people in a lot of the schools. The biggest number is at the high school. Those are the guys that do the sign-in at the front, you know, entry sort of people. And I will get a letter out to all of those people telling them, probably get it out on Monday, basically instructing them to just contact their department head and to use their best judgment. We will look at individual cases if ours have not been able to be completed by November 1st. That's basically the point that we set for completion of your volunteer hours so that it can appear on your January 1st tax bill. However, if there are a few hours left, and I know most of these people, they're not going to, you know, squeak out of 10 hours or 15 hours, whatever, they'll complete them. And that way we can get that taken care of and also make sure that people get the credit that they worked for.
On that one, just personally, I don't want to force a senior or veteran doing a work-off program to feel like they have to come to work just because.
Yeah.
So I would ensure that, tell them, I can't guarantee, we'll make it happen. And if we have to go out and get asked for funding someplace else, please do not force them to think that they have to come to work to get their tax.
No, and I absolutely agree with you, Ian. I would never do that. I mean, I want people to feel comfortable. I don't want them. Today was really a good tell for us. We had 3 of our larger classes meet at the senior center, and all 3 of them had less than half the number of people. I think most of the folks are, you know, I'll be very honest, they're afraid of this. I've never seen my mother afraid of anything. She's really scared about this. So I think that a lot of the seniors that I've talked to kind of feel the same way. There's so many, like, unknown things going on out there, and every day, like Steve has said, it's very fluid, literally from hour to hour, and I think that's how a lot of them are feeling. And I certainly would never want anybody to think they had to do anything under the circumstances. And they also know they're the vulnerable targets.
So I think Ian, you said it very well, where, you know, we don't want to have people feel like they have to do something that is unsafe. And I think the Board of Health would, echo that as well, in that if people are feeling like these volunteer hours are putting themselves in an unsafe circumstance, that's not a good situation to be in. And we would advise that the other groups in town to make sure that they don't put any undue pressure on that. I would hope that, I know that we've heard several groups ask for volunteers. I know that both in terms of, like running the town elections, or even the food pantry has said that a lot of their volunteers have backed out because they're afraid. I don't want to put anyone in a situation that they're afraid of, but there may be actually places, and I don't know whether it would count as part of this program or not, but the food pantry, some of the stocking of shelves and stuff like that might be able to be done in a non-risky way, and still allow them to get in hours without necessarily being surrounded by lots of kids and that sort of thing. So we may have to be a little bit creative in solving some of these problems, and I hope that we can come up with a way to be creative. But for other people in town that are looking to say, how can we help out in a situation like this, there are certain parts of town that you can help out in, and there are places to contribute.
I did have one person who
I think actually
did, I'm sorry. I did have one person who did withdraw this week because he does have a compromised respiratory system, and he was actually going to the high school. And I would never, and I don't want people to feel that way. The most number of volunteers are actually at the senior center for all the departments. And I think that for most of them, like we have one person at the library, and we have one person in the treasurer's office, and we have, Pat, you have two? So, we don't have a lot of people, but I certainly will make it very clear in my letter to them that you make the decision that you're not going to be penalized. If this is all better by July, then we keep going.
They have, it's not like they have to get it in the next month. We have time to still get their hours in, so I just want them to feel that they do not have to.
Department heads are aware enough
If I can actually just let a couple of people that have their hands up. I think we've got one person here first on the school committee.
Hearing that they're volunteering, I'm surprised there's not an exemption for their hours for a very different type of situation, unprecedented. And why are we giving them the choice to go versus what we're doing pretty much for the town right now, which is making strong decisions about what should happen and setting a clear boundary to prevent, really looking out for the health of our seniors, looking out for the health of our citizens. So it's surprising to me that giving them the choice is out there versus, what we're doing for the rest of the town.
Yeah.
That's entirely up to you.
So our chief assessor is watching from home, and he's texting me saying that we do typically have a deadline date of November 1st, but we could go as late as March or April of 2021. So there is a lot of opportunity for extending that deadline.
Yep.
Thank you. Let's see. So we have.
So can we hit on that then? So. And pardon for my ignorance, though, is Chris, I'm looking to you, but from the seniors tax relief program, is it under the authority of the board if we said that we wanted to basically postpone that program or recommend that the Board of Health postpone that program till at least the end of the month and relook at it?
Yeah, you could certainly make the recommendation. Yeah.
I'd make that motion.
Say that in a letter.
I move that the Board of Selectmen recommend to the Board of Health that the Senior Tax Relief Work-Off Program and the Veterans Tax Relief Work-Off Program be suspended until the end of March for future to be considered then as an appropriate safe time to restart the program.
I second that.
Any further, this is on the board side first to you guys, so any further comments on the board side? Okay. All those in favor? It's 3-0, 3 being present.
Would you like to make a motion?
God, can someone repeat the motion, please?
Ditto? I don't know.
Yes. I bid. I make a motion that we excuse the seniors and veterans from the work-off program. Suspend it till a date to be, did you guys have it?
We said to the end of the month.
Until the end of the month.
So I've got a question. Is it possible for us to just, in the wake of, while we have school closures and other public health things going on, that they just automatically be credited whatever hours they've been
Is that
contributing? I don't know whether we can do that. We can certainly recommend that they look into that.
So
but
I don't think crediting him is within our purview.
I don't think it's in your purview.
Yeah, so our purview is just to suspend the program for right now. We can make a recommendation, but we can't.
Let's act on the first motion then to suspend the program. And all those in, do we have a second on that?
Yeah, I seconded it.
Okay, all in favor?
Aye.
I'd like to make a motion that the Board of Selectmen or the Assessor's Office look into whether they can credit any of the seniors that are affected by this closure that we just made of the program in some way to compensate them hours that they would have otherwise worked. And while that may not be possible, I think that I'd like to make that motion that we recommend that they look into it.
I'll second it.
Okay, all in favor?
Answer.
Aye.
I do have some.
The other.
Go ahead.
I know that Syed brought up about social isolation, and that is a big concern of ours. We, the Council on Aging, well, the Senior Center has maintained an internal list, emergency list of people that, in the community that we're aware of, because we obviously can't know all 4,200 seniors in town, but that are at risk either for health reasons or isolation reasons or whatever. This list is currently being updated by my staff, and that we will be checking in with these folks, a phone call, because as far as my outreach staff goes right now, I did speak with the 2 nursing homes and elder complexes today. There are no visitors allowed at Westborough Healthcare, Beaumont, or Whitney Place. All visitors have to sign in at the Willows. The Highlands are preparing to quarantine in place if necessary. And what I would say, since I have a captive audience out there someplace, is that if you'd like to be on our list for a phone call or a check-in, please call me. Call the office.
And I would encourage people that are watching or listening, this is not the time to be alone. I mean,
No.
this is social isolation, being alone, especially when you're elderly, comes with its own significant health risks. So don't withdraw into yourself.
Although the best way to reach out might not be to go over and hug them, but it might be to give them a phone call, check up with them daily, give them
or something.
communication, but it doesn't necessarily have to be in person.
Wave through the window and.
Yes.
We have a lot of telephones at the
Okay.
senior center. And then the other question that I wanted to ask, because this came up with the schools also, is that we also have evening activities. The community chorus meets at the senior center regularly. I know they're ramping up for their show, and I have no idea what they're going to end up doing. And also the garden club meets there every month. I know. I don't know if you need to make a separate motion to prevent that from happening at the senior center or.
Yeah, they're not essential.
I think for consistency, it's the use of town buildings by outside
Non-essential
organizations.
So I think
Non-essential meetings.
For non-essential
So
meetings.
for things like the chorus and the garden club and maybe the caregiver dinners, maybe we can lump all those into non-essential meetings. I do want to separate out things like the Meals on Wheels that Bay Path is doing and, some of the things that I would actually consider essential services that I don't want to.
So just a little piece about the caregiver dinners.
Sure.
All of the food is cooked at the senior center, and we send out between 55 and 60 meals on the first and third Thursdays of every month.
The meals go out or people
Yeah.
come in?
No, they go out.
Oh, okay.
They go out with volunteers. They're packaged and sent out.
So then let's take the chorus and the garden club and other non-essential activities that are happening at the senior center, and let's hold off the caregiver dinners and the Meals on Wheels type of activities for right now.
Okay.
And so maybe we can have a motion then on what we want to do with the non-essential activities at the senior center.
I move that non-essential activities at the senior center be canceled until further notice.
Or postponed. Could we?
Hmm.
Yeah. Okay. All in favor?
Aye.
So now we have the essential services, obviously making meals that are at the senior center that are going out to at-risk populations has kind of, this is what I was talking about at the very beginning of the meeting, where we have to kind of look at the risks of doing the activity, the risks of not doing the activity, the benefits of doing the activity, and the benefits of not doing the activity. And this is one of those ones that, it's a good program, and cutting it or stopping it, it incurs some actual significant risks. And so we need to balance that out. And so I don't know if we have any other comments that we want to make on this.
I think they are essential services and should be continued.
And is that your thoughts
do.
too?
I mean,
You're looking at this as something that you want to continue?
I think my intention has been to continue the support services, like the caregiver dinners, like Meals on Wheels, the transportation piece, the nurse being at the center, the homemaker. I did send a letter out to all the homemakers clients today. It'll be mailed out tomorrow. Some of those things that are just, I mean, to support people being in their homes. I also have a great outreach staff who does a lot of you know, home visits and such, but if their visits now have to be by phone, that's okay too. We're preparing for that. So, and I, you know, certainly somebody will always be at the senior center to answer the phone no matter what, and we'll give people our best answers to the questions if we have them at that point. I know there'll be some high anxiety as this thing kind of ramps up, or maybe it has already, like Dr. Ehrlich said, and we're on the, you know, we're on the other side of it, but.
So I think at this time, I'd like to make a motion that we allow or approve that you continue to operate those services that you deem as essential, and leave it with the department head at the senior center to make that discretion, but to please be in contact with either the director of the Board of Health or the Board of Health directly about issues that you are questioning, so that if there's something in particular that you want addressed, you actually have the right people to talk to.
No, Steve's still taking my phone calls when my name comes up on the caller ID, so thank you.
Steve doesn't sleep these days, so.
Do we have a second?
I'll second it.
Any other discussion on that?
Not on this topic.
Okay. Then,
I do have one point to make, which is it's probably a good idea to minimize the risk associated with these activities, to have some degree of personal protection equipment available, and I don't know what you have available. So for instance, for the delivery persons who are doing Meals on Wheels, are there gloves available? Okay, so encouraging the use of that. And even on the buses, if there were masks that people could don for their own protection and then reducing the risk of spreading illness to others, it wouldn't be large. I mean, the buses aren't, you're not talking about large buses, they're smaller ones.
10, our smallest one is 10 passengers, our biggest one is 22.
Yeah. I mean, is that an option to have that available for people to pick up? Or
It is, but my drivers also have the ability, if somebody, you know, they open the door and somebody's coughing all over the place, say, I'm sorry, but you're not getting on the bus today.
Sure.
So, I mean, we, you know, they don't have a problem doing that and have done it. I think that we also, when we have had someone who really needed to get to a physician's appointment, we've offered them a mask and had them on the bus by themselves.
I see.
So we try to mitigate in that direction too.
So to the extent that these things are available for people to choose to use, I would encourage that.
And there are gloves on the bus for the drivers all the time, so.
Okay.
okay. So did we take a vote on that or not
Yeah,
yet?
wait, no, we're about to.
Okay, so let's take a vote on that. All in favor? Aye.
Is that it for you, or do you have,
I think as far as the senior center, I think we
I have some
covered
things. Mr. Mash, do you have something that you wanted to add?
No, I'm good.
Am I allowed to ask, raise my concern? Yeah.
Sure.
So I know we talked about this, so, you know, the people that, we discussed this briefly at the Board of Health meeting, the people that you take care of and you do a great job. And so my concern has been with the people that potentially you don't know about, or we as a town do not know about, and that is my concern. So I recognize there are other groups in town, so I'm wondering if it is worthwhile, and again, I don't want to be telling you, but worthwhile working with the Board of Health or these other groups to set up a committee to look at the, like for instance, pastoral services through the churches or through the synagogues, maybe to have a meeting to make sure that either we incorporate those groups into our services, or that they know what we are thinking or what we're doing. Am I making sense?
No, I understand what you're saying. We do work very closely with several of the parish nurses in town.
Okay.
I have a great relationship with the Housing Authority Director. We talk all the time. I mean, we're trying to, you know, we try to reach out as much as we can, especially in a situation like this. It's interesting how many people, I mean, our emergency list is probably close to 300 names right now. So it's not like we're not,
There are some people who are never going to ever come to the senior
No, I
center for
understand.
any reason, whatever.
Right.
However, you know, we have a lot of people that we reach out to, that we contact, that are regular people that come into the building that maybe don't require some kind of support services, but if they're not coming in to exercise 3 days a week, they're probably going to get a phone call from us at some point just to say hi. We will utilize my senior center scanning card, that list of people that we can take a look at that. I mean, there's a lot of avenues to do that, and if we're, and it's never downtime, but if we're not running activities and programs, then we've got time to do a little more of that outreach.
And then sorry.
You have one other question?
Yeah, and the other thing that I had was, one of the concerns that the other concerns that I've had is a lot of the Asian seniors are self-isolating themselves because they're scared of going out, there've been incidents directed against them. And already there's a language barrier with some of them, so I didn't know how to reach out to them.
Well, I do have an outreach worker who speaks Mandarin and Cantonese. She has taken a lot of the information. She has set up I guess it's sort of like a website or an email system with a lot of the folks that she's in contact with, either folks who have come to the senior center or people who have, I mean, just that she's aware of out in the community. She's taken a lot of the information from the World Health Organization, from the CDC, from the Department of Public Health and things like that. It's been translated into Chinese. She's put it on the website and sent it out to them. She's made herself available to people, and she's really trying to keep in contact, especially with some of the folks who are a little more medically challenged.
Thank you.
Just to hit on that, and sorry that it's your meeting, but Syed, for what you said, I mean, that bothers me extremely, and I think if we can find a way of who's harassing or bullying or whatever you're saying, we need to know it, and we need to talk to those people, because that is absurd, and that should never happen in Westborough. So I would appreciate if, it sounds like you have the names and whatever, I think we need to get that information and deal with it, because that is just not how we operate as a community. If we're operating that way, we need to deal with it. So please, what I ask is, I'm not frustrated at you, I'm frustrated at the fact that that's happening in this town, and I want to take care of it.
Well, and trust me when I tell you, if I know about it happening at the senior center, it doesn't go on very long.
That's something that's not exclusive, I think, to the senior center. We want to make sure that,
No, it isn't.
you know, at any age group, that nobody, because of their race or other,
Absolutely.
is being affected.
Absolutely.
But that's like the man who walked in last Thursday. He was reading the sign on the outside of the door, and he walked in, and I said, "Oh, can I help you with something?" And he looked at me, he said, "You can't kick me out of the senior center." I looked at him back, I said, "You want to make a bet?"
I think the final thing that I had on my agenda was the Youth and Family Services and whether we need to restrict or deal with any of their issues. I think that they deliver mostly essential services, and I don't know if there's anyone here from the Youth and Family Services.
If I might,
do you have
in
something
addition
else?
to Youth and Family Services, the team that runs our food pantry is here. I know they've got, you're aware and Steve's aware of some issues that they're having.
Yep.
It might be good to hear. They might be in need of some different volunteers or some different mechanisms of serving the folks they serve.
Okay.
And so helping publicize that. And also, I've received text from at least one member of the pastoral community here that the houses of worship are putting together teams to make sure that people who live alone, who are elderly, will have meals and will have contact. So in addition to the resources from the Council on Aging, the Senior Center, the broader community is engaging as well.
Yeah, I was going to add that. I know that, and I see a lot of those folks that are in those volunteer groups, I know and have been reached out by a few of them, but we have very active clubs that I'm sure will help out. And if Rotary Club and Civic Club and whatever you need, let us know and we'll help make calls, because especially like if Meals on Wheels drivers, I know there are some elderly people that deliver Meals on Wheels. If they're not doing it, let us know, and as a community, we'll look to get volunteers to help out on that as well.
And that's what I was wondering, is it worthwhile just to have like is it, maybe it's already happening, of all these volunteer groups to work with our town, or is that already going on and I don't? there's a coordination already happening. Okay, all right.
So it's already 8:30. We have the, hold on, we have the youth and family services that we want to talk about, the food pantry, houses of worship might want to say something. Is there anyone else in the audience that has something that they want us to handle while we're all here, just by a show of hands? So it looks like there's one other person that has it. Okay, so I'm just trying to get a sense of the time frame as it's already starting to get late, and some of the town people here actually don't live in Westborough and still have to actually get home to their families. So with that, you had your hand up, Alma, is...
Yeah, I think we're going to postpone that. The council has actually... Yeah, no, the council just sent out recommendations for units to cancel all activities the rest of the month, so that we will, you can pull that off your desk. We still want to hold it, but it's going to be postponed until a time when it makes sense for health.
In light of that, I think that we can take a quick vote. I think the Board of Health is probably going to come down that we would recommend that it be postponed as well. So I make that motion if I can have a second.
Second.
All in favor? Aye.
Yeah, again, I classified under a non-essential meeting, activity, or event.
It's nice when we're all on the same page.
Yep.
So if we could have someone from Youth and Family Services now come up, thank you, and introduce yourself, I appreciate it.
Kara Presley, I'm the Director of Youth and Family Services.
So you guys perform a lot of services that I would consider essential, and so it would be nice to just hear from you of those things that you deem as non-essential, you know, kind of where you draw the line between non-essential and essential, if there is anything that you do that's non-essential. And that way we can kind of help give any sort of guidance we can as far as what we would recommend you do.
Thank you, I appreciate it. So our non-essential work is the educational and prevention programs that we do, the social programs that we do, and right now I've already canceled those. We facilitate a lot of meetings, we host trainings. I've canceled all of those in the foreseeable future, or postponed them. Anyway, we do work in conjunction with Westborough Connects, with Rotary Club, with the schools. Those events, as far as I know, have been postponed. And the ones that I am in charge of, I've postponed. So I'm not too concerned about that. That guidance seems very clear. As far as essential services, I see our counseling and our resource and referral services as essential. My plan at this point is to continue business as usual as far as that goes, although we are already planning in conjunction with the other department heads and the town manager to plan for if there were some kind of need to leave this building, how we would continue to reach out to our clients. I am getting requests from the community about what we are going to do with our counseling programs. And again, unless you guide me otherwise, my plan is to continue as usual with the caveat of do not come if you're sick. We are sending people home if they're sick. And
I don't know if this makes any sense at all, but would it make sense to do a counseling session remotely? Is that something that's even possible? Would you be equipped to do that? Do you need help from any of the town officials to help you with that process? Because obviously, not giving counseling sessions when they're needed is something that I would like to avoid. And
right.
If you could benefit from a remote session, I don't even know if that's possible, but that seems like would be a good idea.
So that's part of my plan.
Christy.
If we, oh, I'm sorry, Christy, go ahead.
I just wanted to say that Youth and Family Services is one of the many town departments that we've been working with, creating the fire chief, being our emergency management director, is working with me on a continuity of operations plan. We've been talking about ways that people can work from home. We've also been talking about potential rotating skeleton crew. So I think any recommendation that the Board of Health wants to make in terms of town hall operations, it would be something that would impact all of the departments and not just Youth and Family Services.
Yes, but to answer your question directly, part of my plan is if we had to be remote, we would offer phone sessions. We're not really equipped to do Skype sessions or anything like that. I'm not prepared to do that. I don't know that I can do that with HIPAA compliance and all of that at this point, but I'm confident that we could provide phone services if people opted to, and even now while we're in the office, if people prefer not to come in, I'm prepared to offer that to our clients. Now, if we had to do that for a month or more, we would have to reevaluate that because I'm not sure that's clinically optimal
but
Yeah,
it'd be on a
so-
case-by-case basis.
So my feeling is that it is definitely not clinically optimal, and that I consider particularly the population involved to be a low-risk population. So at this time, my advice would be to not, would be to continue services as usual for that population.
Okay.
I think the benefits outweigh the risks at this time.
Sure. I will mention on a not a sort of tangential note that we have a lot of community contacts, and I've been in contact with a lot of community members about this meeting, and people have been asking me to share concerns. A lot of them I think have already been brought up, but specifically I've had outreach from faith leaders looking for, not necessarily asking for guidance, but prepared to follow your guidance about worship services and gatherings of large people. So I expect they are tuned in tonight. They'll be listening to you. I probably won't even need to loop back to them, but I just wanted to raise that and make sure it was part of the conversation.
I think maybe that should be the next issue.
Yeah, that is on my to-do list.
Okay.
I don't think there's any need to take any action with the Youth and Family Services. I think our guidance covers everything so far, so thank you.
But thank you for asking. I appreciate it.
So houses of worship, other groups that are organized in town do have gatherings, and having some recommendations from the Board of Health could be very useful for those gatherings. And so obviously it's an issue that affects a wide range of people with a wide range of beliefs, and so we need to just kind of make sure that we're thinking through this as we make decisions.
So for a historical perspective, during the 1918 Spanish flu pandemic, the Board of Health in Westborough did ask houses of worship not to hold services at the peak of it. And at that time, people were getting infected on a daily basis. You can look at the logs of the Board of Health showing, how many people each week were getting diagnosed with the flu and people dying and things like that. We are not there yet. So I'm not prepared to make such a strong statement at this time. I think that's something that needs to be assessed as the threat level changes. But for now, I think there's, each house of worship would need to judge the risk for themselves. Some places have a lot of space and people can spread out, and some places are very full and people are jammed next to one another. And I think how each facility manages that should be done with guidance of that there is an increased level of risk, but right now it's not real high. That's my overall perspective.
Go ahead. I'll speak after you.
I have a different perspective. So remember, in the epidemic of 1918, the concept of flattening the curve comes from the influenza epidemic of 1918, and there were two. And again, this is the extreme example. The influenza epidemic of 1918 was a big deal, and a lot of people died, and it had a high fatality rate, which, knock on wood, this doesn't. However, there were two cities that responded to events differently. Philadelphia had a major parade that was scheduled. They went ahead with that parade. St. Louis did not. Guess who had the more people die? It was Philadelphia. So my question to the board is, we are still, as a town, we are restricting our activities. We're trying to limit the spread. We're in a position to limit that spread. I think the message, certainly I would ask us to think, is the same message. I think we should be limiting, and I hate this, but I think we should be limiting social gatherings. It's a risk. Some of the congregations are large, and again, this is a deeply important function in a time of turmoil to seek solace in these houses of worship. But I'm worried. I want to hear what you guys have to say.
Well, I want to bring up a reference that's maybe a little bit more recent than 1918. I wasn't around when I was. Board of Health.
I feel like I was.
But in Korea, South Korea, the major spread at the very early stages of this epidemic was through a church that was communing together, sharing a lot of stuff together. And it spread rapidly. And what I hope that our faith leaders here in town can do is kind of look at the guidance that the Board of Health is giving in terms of other organizations, in terms of maintaining space, enough space and distance between people, how to organize so that you can try to create the best forum that you can and still accomplish what you deem are essential services. And so for houses of worship that, may have in the past be doing a lot of handshaking or, a lot of bodily contact, if you can find a way to accomplish the same goal, but without actually having the possible transmission of the virus, I would recommend strongly that they find a way to take those actions. But each individual group has their own special beliefs that they feel are very important to them. And I want to be careful that there's a little bit of separation between kind of the state from the Board of Health and people's individual religious, beliefs, that we don't impose our will on them, other than we do want to protect public health. We want to make sure that people are aware of what is safe behavior and what is not safe so that they can make up their own minds. And I think that from my feeling on this is that groups should be concerned. This virus can spread in communities, especially in tightly knit communities that are present together in enclosed spaces. And for those that then go out and seek vulnerable populations to go and help, it also becomes a larger risk point. And so I don't think I'm at the point now with the current state of COVID-19 in Westborough that I would be looking to enforce any sort of action on congregate settings, but I would recommend that those people that are organizing large groups of people look into it to try to figure out the best way to keep people safe. And so whether it be a meal where people are sharing a meal, finding ways to make sure that you can do that safely. Buffets in general tend to be a little bit more risky than if people are sitting down and they are served. Making sure that there is people that are washing their hands, that there are hand wash stations available. Even just the way people use silverware in the area, all of these small things can actually have a big effect. And so I would recommend that anybody who is doing any sort of activity like this really look at how they're doing it, why they're doing it, and if they think that those things are needed or could be accomplished in any other ways.
If I may.
Yeah, we've got a whole bunch of comments. We'll let
I was going to say, I think I would ask that maybe, the recommendation we've given is about non-essential meetings, activities, events. If faith is, there's worship, but then they do also offer a lot of events. I think giving a recommendation similar to this, that non-essential ones, they should consider canceling. Again, I understand that separation. They're going to make that final decision, but I think if they're, as we heard, looking for some guidance, I would, I think we have provided that guidance. I would recommend you provide that guidance to them as well, because it's something you've made a point on the town side we think is important.
And I just received a text from a member of the local interfaith clergy group that they've been communicating online and are preparing communications that most will be canceling most in-person meetings and focusing only on essential religious activities at this point in time.
Okay. So I'm comfortable making a motion that we recommend to houses of worship that non-essential activities be postponed, but that core religious activities can still take place.
I think that would be fine, and I would, not as part of that motion, but for people interpreting that, the definition of essential services is left up to those individual houses of worship. With that, I second that motion. Do you have any other comments?
I was just going to say that, Kara, if you can help spread that word, that would be work with Steve. We're going to be releasing a communication, so if you can spread that out in your contacts, that'd be great.
Okay.
Thank you.
All in favor? Aye. So the food pantry was, I think, the last item then on the list. Do we have someone here from the food pantry? Yes. Excellent. Please come on up and introduce yourself. You doing okay on time?
Yeah.
Thank you. Do you have to try?
Okay.
Evening.
Good evening. So we'd love to hear a little bit about what's going on at the food pantry and how this is affecting you and what we might be able to do to help you.
Well, my name's Phil Kittredge, co-president. This is my wife, Donna. And
Before I start, we're not a town agency or town board. We're an independent 501c3 corporation, and everybody thinks we're part of the town. It's because we work continuously. Just within the last month, we worked with both the police department and the fire department on individuals that are having issues, food issues. We work with youth and family services on a regular basis. We work with the schools on a regular basis. We just delivered 4 emergency boxes of food to Mill Pond School for food-deprived families that either are too embarrassed or for one reason or another don't want to come to the food pantry. So they're being given up by the school. So we have a spectacular working relationship with all of the boards. And especially the senior center and the selectmen and the town manager who supports the food pantry, like all the residents in Westborough. It's been great. A week ago, I wouldn't think I'd be here. Things were going along fine. Within the last week, I've started to get a little pushback from my volunteers, which are primarily seniors, a lot of them with immune deficiency disorders. We have some that are undergoing chemotherapy. They don't want to volunteer anymore right now. We're getting a little pushback. I can tell by the numbers. Our numbers are off over 30% in the last month from clients coming to the pantry. We have 150 families registered, and we feed about 270 people. We're down to about 70 families that are coming on a weekly basis. And part of that is our particular layout. We are elbow to elbow in chairs in a small area, and when we open the doors, there's 25, 30 people that come through that door at the same time. It's tough. So we have decided a tentative decision, and I spoke to Steve this morning, spoke to the Worcester County Food Bank. We're going to close the food pantry, it looks like, until April 1st. We have the mailing addresses of all our clients. We have Hannah Kane that runs a golf tournament for us every year and earmarks money for farm stand coupons. We're going to take that $18,000 and purchase gift cards and mail them to our clients directly. And that'll give us a couple of weeks to give us some time to maybe put together a bag program. We're a selection pantry where the people come in just like they would go to the grocery store and pick items off the shelves. So it'll be a little different. We'll have some volunteers bag up groceries, call these people in one at a time, give them the food, so we won't have the big crowd of people, because they are really, again, shoulder to shoulder in there. We don't want any of our volunteers to feel that they're uncomfortable or unsafe. I had two more today, that said this is their last day. They live down the Willows. They're scared. They really are. And so we're going to be without them until this virus runs its course. But I want you to know that we're going to do our best to make sure that the people in Westborough continue to get the food that they need. And where I have the opportunity now, and we are being televised, instead of making canned donations or donation food, it would be ideal right now if you could donate gift cards, because that's what we're going to be sending to our clients for the next probably.
Where would your preference of gift cards be from? Stop and Shop, Roach
Brothers?
Stop
and Shop or Roach Brothers.
Okay.
Because the senior bus will, some of them don't have transportation, and it's a little bit of a hike from Maybury Drive to get to the grocery store. So that's where we're going. And again, we wouldn't be here without the support of all the other town departments and the use of the Forbes Community House. That's where we are. Any questions?
Yeah, do you?
Go ahead. No,
Real
please.
quick, do you have an online presence for people who want to make donations that way so that you can buy the gift cards, or do people have to buy the gift cards? And how would someone drop them off if they want to make that donation?
Well, lucky for us, and Wendy just left. Wendy is the treasurer of the Westborough Food Pantry, so anybody that had cards, food cards to the grocery stores, they could drop them off at the town clerk's office.
and mark them with our name on it and give them to Wendy, which a lot of people do already. So that won't change, but.
Or they could be mailed to our P.O. Box of 502, Westborough, Mass.
P.O. Box 502?
P.O. Box 502.
Maybe in our communication after this meeting, maybe this could be part of that communication. That, you know, donations to the food pantry can be dropped off at the town, that we would prefer donations to the food pantry be, you know, that could be part of the town communication after this.
In as much as it's possible, if there was a place on the town website that we could link to this, you know, organization, I think that would be useful for a lot of people. I know that because it's not part of the town, maybe it's not possible, but if we could, they do provide a lot of services for Westborough residents, and it would be useful.
You know, I've been to the grocery store a number of times in the past couple of days, and certain things are empty, but, you know, there's still plenty of food, nutritious food that can be purchased. So I wouldn't want to discourage anyone. I don't want anyone to be discouraged from making donations because I think it won't be of any use.
I think I just wanted to go on record that there's, you know, a larger systems issue that, thank goodness, we are addressing it in this way, in support of the food pantry, but I do wonder if we will get more feedback that we continue to.
One thing I'd like to offer up, and that, as you mentioned, you're at the Forbes Community Building. As you know, right now, the upstairs is mostly empty. I think there is some town, I would say, for this time, not permanently, but feel free from a space, and if you need that, to feel free to utilize the space in other parts of the building, if that would be helpful.
It would be helpful, except that I've got two issues. I have clients that are a little reluctant to come, and I have issues where I have volunteers that are reluctant to come. You got to realize that probably 70% of my volunteers are all retirees. So that puts a real crimp into, there is a lot of fear. I'm sure you've heard it. We've lost probably 5 volunteers in the last 2 days.
Yeah, the other issue that's probably going to confront us as well is that a lot of people that are hourly waged people, if their business closes or changes their hours, they could find themselves without some income that they were depending on, and might actually provide more people that would have otherwise wanted the services that the food pantry provides. So there could be an actual increase in the number of people that need the services, even if they aren't actively going there because they're afraid. So it does actually highlight a need in Westborough that we have to find some way to address.
No, and it's just an offer. I mean, and if it's, what I heard, you know, if it's crowding when they come in, if there's space to put people to, you know, sit upstairs and wait to come down. I know we also have the stair issue. We don't, you know, the accessibility is either directly in the back door. If you come in the front door, you have to go upstairs. But if there's things, or if you're doing the bagging program and you need to store bags there, but just keep that in mind, that is there, you know, for your use at this time, if you deem that you need it.
Well, if you're probably aware, one of the problems that we have down there is we're in a basement with limited windows, limited ventilation. Some of the rooms have no windows at all. 3 of the rooms, the main distribution room, there are no windows. And you're probably aware that my wife was able to speak to one of our state senators and obtain a $50,000 grant to air condition and provide ventilation for that building. So that's in the process. So that will help. Right now, it's a problem. You know, it's, somebody comes in with body odor, you smell it for the rest of the day because there's just no air movement. It was never, the basement of the building was never designed for what we're using it for. That's the problem.
There's a locker room.
Yes. So I think, you know, we'll be better off. One of the things about the space upstairs, if we start to bag groceries, and that was one of the, when I spoke to the Worcester County Food Bank this morning,
That was one of the suggestions that was made, to go from a selection program to a bag program where we can make 300 bags of food upstairs and have the clients, they don't even have to come into the building. We'll bring it outside. When they pull up, put it on the table, they can take it off the table, put it in the car. That will allow us to continue to give them the fresh meat that we get every single week. Instead of just
Did you
giving
need
them
to
vegetables.
vote on opening up the upstairs floor, or is that just something that you can let them do?
If you want to vote on it, we can.
Yeah, if you want to vote on it, I mean, it's really kind of the town facilities, but allowing them to use the thing for now, I don't.
Yeah, I mean, I can approve that, so
Okay.
we can
That's fine
certainly
then.
do that.
Thank you, you've done this before.
Approved.
Actually, to be full transparency, it was her suggestion. If you look, I get a lot of ideas from our town manager, so I'm not the smart one.
Credit where credit is due.
Yes.
In closing, the only thing I'll say, this is a wonderful town to be a social service agency. The cooperation between all the town departments and us, the churches, the Kirkside Foundation, there seems to be an outlet for anybody that we seem to have a problem that comes to us. Sometimes we're more of a counseling group than we are of a food pantry, but I can refer them to all these different town departments, and it's great. They do a spectacular job.
Great. Thank you.
Do we have anything else that any of the other boards that are here?
Actually,
want to
I did
address?
have one more, and again, this was one that the town manager reminded me of, giving her credit as well, but like to ask for your guidance about, because I know we have at least one situation, but town employees that may be out of town presently at conferences, now we've canceled it now, is there any guidance on their return if they are at an out-of-state conference with a lot of people that you would give as a board? I know I've seen companies that say self-quarantine or whatever, but is there any guidance that you as a board would give to us for town employees that are returning from conferences?
Yeah, so as we discuss this, I can chime in first, I guess, and that would be that depending on the nature of the conference or whether they think they're exposed to something, it might be different than if they don't believe they were exposed. And if they believe they were exposed, I think they should come home and they should quarantine themselves. They should, wait to make sure they don't have any symptoms. If they're in an area where they don't think they were exposed, I think my recommendation at this point would be that they don't need to, take any extreme precautions at the moment. I would say, though, that coming home is probably safer than staying at the conference. But with that, I'm going to let some other people chime in, and I may change what I feel.
So my concern, so with the caveat, my concern is, I mean, if they're coming from Kansas City, I think the risk is lower. But if they're in an area of high activity, Washington State, places where emergencies have already been declared.
How about Las Vegas?
I'm sorry?
How about Las Vegas?
Las Vegas. I don't know.
As an
Nevada?
example. I'm serious.
No, I hear you. And the problem with Las Vegas is, again, a lot of people, those are, to me, it's kind of a high-risk scenario, I guess. Because, again, Las Vegas is not just where people from the United States come, but it's where international travelers are also congregating. So
I largely agree with what you're saying, which is if the person has gone to an area, whether it be overseas or within the United States, that has a high number of cases, and I would include the entire West Coast, California, Oregon, and Washington in that grouping, then I would suggest self-quarantining. Las Vegas, to the best of my knowledge, has not had problems with coronavirus yet. Again, what I'm saying could be out of date from 2 hours ago, right, or 2 hours from now. But, I think one can look at where are the hotspots, and quite honestly, Boston's a hotspot at the moment. Yep. So Boston might be worse than Las Vegas. So I think each situation has to be judged on its own merits. And I think if there are questions, certainly on an individual basis, if they're directed to the Board of Health, we can try and get the resources at that time to be as timely as possible with advice. So I'm not sure any blanket advice right now is going to hold up for even, a few days.
And also, we have DPH, right? DPH has a line, a travel line that travelers can call. I don't know that number, but right off the top of my head, so actually better than the board making a decision about this or commenting about this, there is a specific traveler line that you can call at DPH. I just don't have it right in front of me.
And obviously, if the person develops symptoms after having traveled, they need to, isolate themselves. And so I think that there's a range of precautions that should be taken. I think that they should be working with their managers. They should be talking to them. We don't like to discuss in a public forum individual cases without giving notice to the person that we're talking about and that sort of thing. But in general, I would say that, if you are traveling and it's non-essential travel, cutting it short and coming home, it seems very reasonable. If it's essential business and you need to finish it, I don't think we're recommending that you, just drop something that is considered essential for the town. But, I think traveling away from home does have some risks.
Perfect. Thank you.
Yeah, I did, you were mentioning how obviously if you've traveled and you have symptoms, you should self-quarantine. I want to make it clear, symptoms alone don't come to work, okay? Because we know that at some point it's going to be spread even if you haven't been in an at-risk situation. Okay, and so if people are having fevers, they're having respiratory symptoms, if you feel sick in whatever way, you should be staying home from work at this point in time. And that applies to town employees as well as everybody else.
Absolutely. Thank you. Thank you.
Good, so with that, I think we're going to close this meeting.
I will.
We've got one other comment before we close, I guess.
Sorry. One last question. Bay State Commons, okay? We're starting to get people submitting applications for outdoor events. The first one's as soon as April 4th has already been submitted, so my understanding it's a piece of town property. We will be denying those permits.
Yes.
Do we want to have a time frame associated with it?
What are the
Because if
dates?
they're planning,
Well,
let's say, for next summer or something,
Well, the first one right now, I have one April 4th, I believe it is, so that's right around the corner. And then they go, the screen on the green, I don't know, when does that start? I signed it today, July, so that's quite a...
I think for the stuff in April, I'd be confident saying that we postpone or cancel those. For stuff in July, I think that they can apply, put the application in it, and we'll evaluate when it gets closer.
Okay, very good.
I agree.
Okay, so let's make a motion that anything for March or April that we...
So through the end of April?
Through the end of April.
Through the end of April, yes. So if I can have a second on that?
I'll second.
Okay, all in favor? Aye. Okay, with that, I'd like to close the meeting and thank everyone who came or listened on TV, and I appreciate all the hard work that our town officials have put in. It's actually nice to be in Westborough.
Yeah, and I would say, we talked about isolation of seniors, so, now's a good time to call your parents, just.
So for the Board of Selectmen, a motion to adjourn?
Oh, yes, we do.
I'll second it.
To adjourn?
All those in favor? Aye.
Edinburgh, yes.
I make a motion to adjourn.
Okay, I second it. All in favor?
Aye.
Thank you.
Sorry. She looked at me.